All right, you're now live on YouTube.
Did it work for you?
Okay.
We're good to go, Bree?
We are good to go.
Thank you. Good morning, everyone. Hope you had a good weekend. We will begin the public hearing. I don't see Representative Scanlon is going to be joining us in a little bit. He had some obligations work-wise, but as you know, he's always very punctual, and he will join us as soon as he can. I don't see Senator Martin yet. Representative Cheeseman, any beginning comments?
No, Chairman Fanfara, just ready to rock and roll on this beautiful Monday.
Very good, thank you. In that case, Bree?
The first testifier is Jennifer Widnes.
Good morning, Senator Fanfara, Representative Cheeseman, and distinguished members of the Finance, Revenue, and Bonding Committee. I am Jennifer Widnes, President of the Connecticut Conference of Independent Colleges, and I'm here today to speak in favor of Section 1 of HB 5476 related to the provision of fee reductions by stormwater authorities. By way of background, in 2021, the legislature passed a law authorizing any municipality in the state to create a stormwater authority that could levy a fee on real property based on the amount of impervious surface contained on the property. Fees collected by the authority are to be used by the municipality to offset the costs of stormwater mitigation efforts. Uniquely, stormwater authorities are authorized to assess fees on both taxable and non-taxable property. A number of years back, the legislature approved a pilot project where a handful of cities were authorized to set up these authorities. New London has been the only city to set one up under the pilot. Section 1 of 5476 accomplishes two things related to these authorities. First, it seeks to ensure the authorities have a thorough process in place for awarding credit in the form of a fee reduction for investments that private property owners have made on their own to reduce or eliminate runoff. This will incentivize private investment in limiting runoff on private property, and it will help limit the exposure for tax-exempt nonprofit organizations. The independent colleges in Connecticut have long sought to be good environmental neighbors. Many of our member institutions have robust sustainability plans and have invested significantly to mitigate or eliminate runoff, as the testimony they have submitted clearly articulates. Second, the bill eliminates grand list assessment as one of the factors a municipality should consider when determining the assessment on a property, as the value of a property has no bearing on that property's level of runoff. Like many nonprofit organizations, the pandemic has challenged the majority of our member institutions. More than half have faced enrollment declines, and all have experienced rising costs due to investments in testing and other safety protocols to ensure we could remain open and keep our students, staff, and communities as safe as possible. While stimulus dollars have been helpful, the recovery will be slow, as drops in enrollment will cause fiscal consequences for the next 4 to 7 years. At a time when many nonprofit entities are struggling due to the pandemic and municipalities have seen increased revenue from pilot and federal stimulus dollars, we are concerned about the consequences of allowing municipalities to assess fees such as these on tax-exempt institutions. We very much appreciate the opportunity to support this legislation today. Thank you.
Thank you very much. Any questions? Seeing none, thank you, Ms. Widnes. I'm sorry, Representative Cheeseman, I did not see your hand there. I apologize.
I'm sorry, I was slow with the raised hand. It always takes a while to get into the rhythm in the morning. Do we still have Jennifer with us?
We do.
All right, terrific. Thank you so much, Chairman Scanlon. Chairman Fanfara. Jennifer, so with the mitigation that you might put in place that would allow that tax credit, how is that mitigation defined? Is it up to the individual municipality? Is there, I know we look at, rain gardens, decreasing impermeable surfaces. How would a municipality decide that you had put in place, or an institution had put in place, sufficient mitigation to warrant the tax credit?
Well, right now there's some language in the bill that requires a fee be considered, or, that a municipality consider offering a fee, but it's pretty quiet in terms of what needs to be considered, Representative Cheeseman. So the bill provides a few more buckets of categories for municipalities to consider in terms of calculating that assessment, but it's still pretty much left up to the municipality to determine what you're saying, like how much of a reduction should there be? And, what should they take into consideration to do that? But the experience in New London has been that the credit program has been very light, very bare bones, not taking much into consideration and not really offering a lot of credit. So the ask here was to put some more language in the statute to just ensure that, this was a priority, that institutions and private property owners that have invested at least get an opportunity to make their case.
So you'd like to see perhaps more explicit language with regard to what factors would be taken into account to allow for a credit?
Right. And so what that's in the bill right now, Representative Cheeseman, is just a few more sections of language to say, please consider this. Municipalities should consider this to reduce the amount of the fee, and they should consider this, rather than just sort of leaving it up wholly to the municipality.
All right. Thank you. It'd be interesting to see, and perhaps we could get some input from Deep on this, what they consider are, the list of things that you would take into account.
So we've talked to Deep a little bit about this, Representative Cheeseman, and they are of the mindset to leave it up to the municipalities to have that discretion. But just so our experience in New London has been that it's not, it takes time and money and work to do it right. And so I agree with you. It would be great to partner with Deep to sort of outline this a little more thoroughly so that it's implemented a little bit more consistently across the state.
All right. Thank you very much. Thank you, Chairman Fanfara.
Thank you, Madam. Senator Martin.
Thank you, Mr. Chair. Hi, Jennifer. Jennifer, can you tell us what type of fees you're currently paying?
I think Mitchell's paying about $20,000 a year, and Con is paying about $60,000 a year.
And who's that paid to?
The Stormwater Authority in New London.
In New London. And can you just briefly give us examples of what consists of the stormwater management that you, I guess you're incurring costs in order to do this? Can you just give us an example of that?
So the money that the colleges pay to the city to mitigate, so I guess New London's investing in its infrastructure, Senator Martin, to reduce runoff, right? Mm-hmm. So the city, the colleges are just being assessed these fees to contribute to that work, right? So already, we have some written testimony online, Senator Martin, about some of the work that the colleges have done on their own property to eliminate or reduce runoff by creating retaining ponds, like making sure they have the right system in place under their fields. There's a number of examples that they've provided in their testimony to say that they're reducing the impact in their community already. And so they're just looking to pay a little less annually because their runoff has been reduced. Does that make sense?
Yeah, yes. I'm familiar with developing, retention ponds and the like for reducing some of the stormwater. So the fee is going to the municipality or this authority to maintain those ponds, correct? Or the stormwater system?
The fees go to the city to support the infrastructure broadly, Senator Martin, not really it doesn't go to support what's happening at Con and Mitchell. It's saying, it's a fee that everyone would be assessed. All the property owners in the city are assessed to support infrastructure that the city needs to put in place to limit runoff and flooding, right? So it's sort of a collective, it's a collective effort that the city is prioritizing that this needs to be done. So assessing fee on all landowners to contribute in that work. Does that make sense?
Yes. And Jen, when does that fee get set? So is it the time of when you submit a site plan and those negotiations are taking place?
Nope. So it's the authorities create, sort of probably a budget, right? They're trying to determine how much money needs to be raised annually to accomplish the projects that the city has prioritized need to be done. And then they determine a fee based on, square footage of impervious surfaces. So they probably figure out how much impervious surface exists in the city. And then they figure out how much money they need. And then they divide that up to figure out what cost per square foot everyone should pay.
And your ask is for that amount to be negotiated with the municipality
right. So
we're entitled to a reduction because we've done these extra measures.
Exactly. So our runoff, exactly, Senator Martin. So as far as I know, it's not necessarily based on how much runoff is actually taking place. So if you have a large parking lot, right, but you've created a pond, I'm not an expert here. So I see Senator Cohen on here, who's chair of the Environment Committee. So she would know this better than I, but my sense is that you take your square footage of your parking lot and they assess a fee based on that square footage, but they're not taking into account if you have a pond, right, that's collecting already that water, that's already eliminating or reducing the runoff. So the language in the bill would give a private property owner a little more, position them a little better to go to the city and say, this is the fee you've assessed us, but this is how much we've already eliminated our runoff. Would you be willing to reduce our fee by a certain percentage because we've already invested to eliminate the runoff and reduce the impact in the municipality on our own? Does that make sense?
Sure, but I guess it is you negotiate that up front,
right?
At the time of site plan approval, and are you talking about additional work that was done afterwards?
So,
and if that's the case, why would you not renegotiate the terms at that point?
30 seconds, please summarize.
So you negotiate, I think you just get a bill right now, Senator Martin, that's based on how much the city has determined you owe, right? And so we want to be able to say up front, here's all the work that we've done. Can we reduce our fee this much? So it's not necessarily based on when the plans are submitted, Senator Martin. It's because these authorities are being created, now after the work may have already been done or after the work is going to be done. We just want the opportunity to go to the city and say, here's what we're asking for, a reduction of credit because our runoff has been eliminated so much. I think the plan, an institution or like an entity's plan, there's also negotiation done at that time as well, but there may not be an authority in place at that time.
Okay. Jen, thank you. All right.
Jen, I'm listening to you and it sounds like there's not a relationship between your assessment and what you're actually creating in the way of runoff, correct?
That's our sense. That's correct.
So why then, because let's say you had no impact, there's no runoff, but you're still assessed a fee, right?
Exactly.
So why, I understand there's something in place already and you want to modify it, but if there is no relationship, it seems like this is a way for the authority to address problems in general. It's not specific to Mitchell or any other institution you represent, right?
That's correct.
So if everybody did this and they were, I guess you're not asking that you be eliminated from the fee, you want a reduction in the fee.
Right. I'm asking for there to be just the clearer language, Senator, to prioritize that you want to incentivize private property owners to eliminate their runoff, right? Right. Because that would help the problem and be cheaper than the municipality having to come in and fix it. Right. And this is something that happens. Other states have these authorities in place and have had them in place for a very long time. Vermont and Maine, for example, have very complex credit systems in place to incentivize what we're talking about, what I was talking about with Senator Martin. And to your point, if it doesn't take into account the amount of runoff that we're reducing, then you're not really changing the status quo, right?
Well, my question was that you're not asking to be eliminated from the fee with this.
We're not.
there's still a contribution you're making, right?
Exactly. That's correct, Senator.
So for those areas where the authority is seeking to address, I guess if you took it to an extreme where if everybody took care of their problem, you wouldn't have resources to address those problems where there isn't the fee being collected. In other words, I'm assuming there are either instances where the problem, there's not an individual or an entity that could address that problem. I'm assuming, but I don't know.
Right. I hear what you're saying. So if like all the large entities cut off their runoff, right? And like all the businesses and colleges and hospitals cut off all their runoff and we were paying zero, then you're left to the residential in Hartford to pay for the stormwater mitigation, right? That wouldn't be sustainable. But what we are asking for is just the opportunity, especially as nonprofits, if we've put in our money upfront to reduce our runoff, could we please be sure to get some credit for that to try and limit the exposure?
Thank you. Representative Devlin.
Thank you, Mr. Chair, and I appreciate listening to this conversation. I jumped in when Senator Martin was talking, and Jen, thanks for trying to explain this. If I could just sort of repeat this back so I know that I've got it, because you raised this issue very late when there was, I think, a bill on the floor last session, and I don't think a lot of people understood this impact. But basically, the intent of the law, if you will, or the Stormwater Authority, right, is to, if we're going to be surface covering our land, there's got to be, let me just use these words, sort of a penalty for that, because we'll create a runoff issue. But what you're asking for is that in cases where that may have occurred, but you've also taken mitigation steps so that there isn't that environmental impact, to have a reduction, not to be totally exempt. Do I have that right?
Exactly. That's right. And right. We didn't see this bill until late in the session, until the hospitals had an amendment. So they have some protections that are in place to limit their exposure as well. And so our ask was just to make sure that the language on credit was clear for exactly as you articulated very well.
Okay, thank you. I just needed to say that so I knew I understood it properly. But it seems logical to me. So appreciate you being here to testify on this. Thank you very much.
Thank you.
Representative Meskers.
Yeah, I'm wrestling with the issue. Conceptually, the stormwater authorities are formed to provide for stormwater infrastructure for the municipalities, right? So there's an infrastructure that's in place that's either good or bad, depending on the nonprofits and or the for-profits who've installed to this date. Given the 100-year storms, the need for further infrastructure, storm drains, stormwater runoff, et cetera, the improvements, I think that was the purpose and intent of this, was to create funds covering the entire if you will, property owners of the municipality, whether they're nonprofits or for-profits. So the amendment you're seeking, is it prospective for future improvements? Or are you asking for credit for installed improvements at this point?
Both.
Okay. So, and there I would have my first problem, because there wouldn't be a real reason for me to grant, other than for the fact that you're a nonprofit and you're doing, I guess, a better work than a for-profit in some level, if I'm making a social valuation. I don't know that I would want to give a profitable company who has stormwater mitigation in place right now credit for resolving the ongoing and increasing problem versus on mitigation that going forward. I'm trying, this is a fundraising exercise for storm mitigation, water runoff, the problems with infrastructure, if you will, stormwater authorities. So I guess you're asking me to reward good stewards that have done the right things to now in mitigation in the tax rate. Conceptually, I salute it. I'm just not sure how I stand, because the issue is there is a lack of funding.
Right. If you look, I just think the problem is that if you've recently, you'll see like Sacred Heart, folks, Representative Devlin, they're doing a lot of work right now, right? They might have already just did those ponds, Representative Meskers, to eliminate runoff.
Yeah.
Just because they did it in July, in May 2021, and the bill passed in June, I just would feel like that cutoff, I guess, is, why shouldn't they receive credit for work that was just done right before the bill passed? That's all I'm concerned about. I'm sure, to your point, like something done 50 years ago may have a limiting value in terms of reducing runoff, right? But to the extent that entities are doing the right thing to reduce their footprint and their impact, I mean, I think it's exactly what you need there. Because to your point, it's so costly, right, to do this work, that if you don't have a private sector partnership here, I just don't see how it'll ever actually, be fully accomplished, right? You need to have private sector partnership here to get this done.
Understood. So
I'm not like Senator Fonfara mentioned, the private colleges are not coming here today to say, remove us from the bill. You're going to hear from other nonprofits that are really concerned. The YMCA camps, for example, the Nonprofit Community Alliance. But from our perspective right now, we put in a number of pieces of testimony to show you some of the work that's being done on these campuses, which we just want to make sure are getting some credit, because right now in New London, there's really no conversation taking place at all.
Okay. But it's not a mandate. It's a request that this be brought into consideration.
The credit, it says shall have a credit system, right? Exactly, Representative Meskers. We're not saying you must reduce the fees that nonprofit colleges pay. We're saying please let there be a process for making that request up front. Because, so what we've heard is that New London was eager to get this going, had a light credit system, and may consider a more thorough system down the road. But it seems unlikely, to your point, that this is expensive. They're not going to go back and start reducing people's fees after the fact, right? Like once you set a budget, they're probably going to stick with that. So we just really want to make sure this is upfront. And this is the language in the bill is similar to what New Jersey has done. Maine and Vermont have been doing this for years and include thorough language around awarding credit.
Okay, thank you. No further questions, Mr. Chair. Thank you, President Favara.
Thank you. Representative Nuccio.
Chair. Hi, so I'm trying to kind of wrap my head around this and figure out. So the state set the policy to have the wastewater runoff. And I think that's appropriate, but it sounds like the problems that you're having are with the town that is applying it. And I would think at this point, that's where you would work that out, is at the town level, because overall, the policy is that we want to have the wastewater remediation. But each town might have something like that. If you have a school in it that is doing remediation, I would think it would make more sense for that to be handled at the town level. So I guess that's where I'm kind of struggling with us coming in and doing something at this point.
Thanks for your question.
I think then we're blanket exempting it across everybody, regardless of.
No, that's not what the language seeks to do. So right now, only one city in the state has a stormwater authority set up, and they haven't really had a thorough credit system in place. So what we're asking is for the language to just articulate a little more clearly that it's a priority for the state to incentivize private investment to mitigate runoff. Okay, so that every municipality would have some sort of credit system in place upfront. So that, as this bill just passed, communities are thinking about setting up these authorities, that they should take into account that, private owners already have sort of invested here, and that they should have a process in place for reducing the fee, not eliminating it from the beginning. And that's all. And it's not a mandate. It's just a mandate to say you need to have a process in place, and that it be done a little more consistently across the state.
Would the town then have the right to decide whether or not they wanted to extend those credits?
Exactly. As long as they have a process in place to review the appeals, Representative Nuccio, so that Mitchell College has these fields. They've invested recently in making sure the runoff, goes where it's supposed to. And Mitchell needs to have a process in place. And New London, Representative Nuccio, to say, here's the work that we've done. We'd like to ask for a reduction in our credit. That's what this is saying, is that And there is language in there already to say they shall have some system in place, but we're asking for more detailed language, Representative Nuccio, to say here are all the things that the city should consider, and that awarding credit is a priority, or consider having a process to award credit is a priority.
There is language in there saying that they should have a credit system.
Right, but that's right.
Okay, that's helpful. Thank you very much.
Yep.
And now we have the authority, the chairman of the Environment Committee herself, Senator Cohen.
I don't know about that.
I know, I'm ready. It's only 9:24. Good morning.
Thank you. I'm sorry, Jennifer, I did hop on just a few minutes late and I missed the beginning of your testimony. I have obvious concerns with this. When we set out to prepare the legislation last year, it was always our intent that there would be some sort of fee reduction, through these municipal stormwater authorities for example, colleges or universities that do have a large percentage of impervious surfaces, for incentivizing them to reduce that number. And that's really those that have impervious surface to reduce it and do better by the environment, whether it be through rain barrels or ponds or things of the like that you've mentioned already. My understanding is that New London, albeit a small one, I think it's 10%, does have a disconnection or reduction to incentivize. Is that correct?
So you paused in I lost your comments for a second. So I totally agree with you. And we know that on the floor in the Senate, when this bill was being passed last session, Senator Cohn, that it was articulated that this was a priority for you and for the committee, that like proper credit be awarded. And it's just the sense that we're getting is it's just not a priority. So that is why we just came back to ask for a little stronger language on it. New London has just they're admittedly were eager to get this up and running and didn't have a thorough process in place. And it's just very bare bones right now. And so I guess our ask was just to have a little more robust language to try and make sure that every nonprofit had the opportunity to at least limit their exposure slightly to try and get credit for the work that they've done. Just because the language in there right now is fine. It indicates credit shall be considered, but we just wanted to get something a little stronger, similar to what other states have done, to make sure that this is a priority and that it can't just be a bare bones process. And so it's not so much about the 10%, Senator Cohn, it's just, what does the process look like, right? Like, how do they go through it? It hasn't really been transparent, at least from our perspective, just in terms of how do we even get that credit.
So is your hope that there will be specific percentages set up at the state level for institutions? No,
I mean, we did talk to Deep in the fall asking for something similar, asking for something like that. But there wasn't a lot of interest. You've talked to Deep about this, and I think others on this call have mentioned that leaving it up to the municipality to figure this out is important because every municipality is different. I mean, would we like that? Probably down the road. It wouldn't. We can see how it goes. I think our concern, and this committee has heard from nonprofits for over the years, that each city in the state treats them all differently in terms of acknowledging their nonprofit status. The assessors can be aggressive, so that's just our concern, is that in some communities, there's going to be a very thorough process for credit in place. In some communities, there won't be, depending on just the level of staff that a city has put in place to run these authorities. So the language in the bill right now, Senator Cohn, is just listing out all the things that should be considered so that we have a hat to, something to hang our hat on to say, look, the statute says you need to consider this. Here's our application for a reduction in credit in the fee. Excuse me.
I guess I'm a little bit concerned about tying the hands of municipalities, but I understand there's so many different grant fee reduction methods. So I think we have to discuss that. And I what I'd ideally like to see is similar to likely what Deep mentioned to you, which is, some sort of good faith negotiations. I think institutions, nonprofits need to be at the table in those discussions as municipalities begin to form these stormwater authorities. But if there isn't, a good faith that they'll follow through with these fee reductions.
Please summarize.
Sorry, I think that's just somewhat unrealistic, depending on the community, right? And depending on the level of capacity a nonprofit to really even follow what's happening. You know what I mean? So I totally hear what you're saying, and that would be the ideal. But I just think we might need a little stronger language just to make sure that this is a priority upfront, just in case there isn't that dialogue.
Thank you. I would welcome further conversation with you. And thank you, Mr. Chair.
Thank you.
Thank you. Seeing no further questions, you're free to go about your day, Jen.
Thanks all.
Yeah. Thank you. Bree.
Thank you. The next testifier, two testifiers actually, Lisa Winkler and Amanda Gunthol.
Thank you, Bree. Good morning, Senator Fonfara, Representative Cheeseman, and distinguished members of the Finance, Revenue, and Bonding Committee. My name is Lisa Winkler. I'm the Executive Director of the Connecticut Association of Ambulatory Surgery Centers, representing all of the freestanding surgery centers in Connecticut. And with me today is Amanda Gunthol, President of the association and an administrator from the Wilton Surgery Center. I just want to start by thanking you all for your past support on the surgery center tax issue, and for really thinking outside of the box through your Senator Fonfara, through your leadership, to look at ways to expand access to the Medicaid population and the state employee population, and to provide some needed relief to surgery centers by proposing Senate Bill 441, an act concerning a credit for ambulatory surgery centers. I'm going to hand it off to Amanda. In our written testimony, provide some additional background, but Amanda's going to talk specifically about the bill and provide some examples that I think that are helpful to illustrate why it is so beneficial.
Thank you, Lisa. Can you hear me okay? Okay, good. Senate Bill 441 recognizes the healthcare cost savings that surgery centers represent for the state of Connecticut, including both the Medicaid and state employee populations, and creates a program that encourages the use of surgery centers to expand access and control costs. Current reimbursements under the Medicaid program have not been increased for decades and simply do not keep pace with the cost of care today. For example, and my center actually does a lot of these, when providing a colonoscopy, a physician may need to use something called a heme clip when removing it. And sometimes in a case, you may need to use 2, 3, 4, and 5 heme clips. The cost of the clips alone can be more than the Medicaid reimbursed procedure. So the procedure costs, we will get reimbursed $446. A standard clip is $148. One, we might use 2, we might use 3 or 5. You could use a rotational clip, which sometimes you will use when you need, like as a way to clip two places with a clip that actually turns differently. That clip is $360 a piece. So this doesn't include the cost for anesthesia, staffing requirements, equipment, and other costs necessary to provide care. Lisa, I'm going to give 2 quick examples. I know you have rates for these that you're going to touch on later, but in the case of a lithotripsy, which is used for kidney stones on an ASC, Medicaid will not reimburse for the procedure, but it will pay for it in a hospital setting or an HOPD or other. Orthopedic cases where that are device and implant intensive, where you need screws and plates and other implants are required for a case like a knee arthroscopy or a rotator cuff repair. Equipment, this costly equipment is not reimbursed by Medicaid. And these examples create barriers to accessing care in our surgery centers. Lisa, did you talk about those 2 rates?
Sure. So I just want to highlight too that the bill really before you begins to address a very untenable situation and allows surgery centers to reduce their own tax liability while expanding access to care, because really we're the lower cost, high quality option. Really, it's a win-win for patients, for the state of Connecticut, and will bring some economic stability to our industry. really, frankly, an industry that's critical to controlling healthcare costs and healthcare spending. Amanda started to touch on a couple of examples. With regard to the lithotripsy, she mentioned that there's no reimbursement right now in surgery centers under the Medicaid program. That's a procedure that's reimbursed in a hospital outpatient department. We just pulled stats from the state's website on the Medicaid fee schedule using New Haven as the basis. But that case is reimbursed $3,700, $3,706.03 in a hospital outpatient department. So that delta between nothing and that, it just represents an opportunity to generate savings under the Medicaid program. Another example is an arthroscopic rotator cuff repair. That procedure, again, very equipment heavy, is reimbursed at $717 today in an ambulatory surgery center. That procedure in a hospital outpatient department is reimbursed at $5,600. So the delta between—
Please summarize.
Thanks. The delta between those two cases, we really, as we've talked about this and done a lot of research, really see as an opportunity to look at how we can work together to control costs and expand access under the Medicaid program. And that's really what the goal of this legislation is.
Thank you. Lisa, could you help the committee understand very simply, very high level, what it is that this proposal does? Because if I didn't know, and I do, but if I didn't know what the initiative is about, and listening to your testimony, it would seem that you were looking to have reimbursement for things you're not being reimbursed for now. That's not what you're asking for, correct?
No, I'm sorry. So many of you know, and many of the members of this committee have introduced legislation to address the surgery center tax that was passed in 2015. And I think we've worked with this committee in a very bipartisan way to address, provide some relief through a variety of changes. This legislation really builds on those proposals and creates a new deduction from the surgery center tax as a means of expanding access under the Medicaid program. It creates a new credit from the tax so that surgery centers are incentivized. What Amanda talked about was that the rates have not been increased for decades, and frankly, that's not going to happen. And so this legislation creates a credit as an incentive to treat the Medicaid population. And so, as we mentioned, there are reimbursements for certain procedures that are equipment heavy. And frankly, the example that Amanda gave, there's another example for glaucoma treatment. The reimbursement for the procedure is $717 under the Medicaid program. The equipment alone needed for like the graft and some other things, $1,600 just for the cost of that equipment. So it's not possible. I think when you layer in the surgery center tax on top of it, it becomes even more challenging to provide care to the Medicaid population. But the delta between the reimbursement is so significant that we really see an opportunity. And so by passing this legislation, it creates an incentive for surgery centers to do more of that care, to reduce their own tax liability, and frankly, expand access. It's kind of like a thinking outside of the box approach. And I think it really creates a win-win for everybody. And basically the state saves money by shifting that care to those surgery centers, where right now it's almost impossible to do. As an example, the lithotripsy, can't even really do it in a surgery center today because there's no reimbursement code for that under the Medicaid program.
But you're talking to lawmakers, and not everybody here has a relationship with an ASC, I venture a guess. So what is it? What's the public policy interest here or opportunity? Can you speak to that? You've spoken to relief for the ASC and pursuing more Medicaid or state employees. Why should we care?
You know, in so many committees this session and in last session, there is a discussion. I think we have some folks from the insurance committee as well. There's always a discussion about the need to control healthcare costs, right? And we really see that surgery centers are a critical element of that policy. And when you look at the Medicaid population, one of the issues that has also been discussed is the limited access and the problems that folks have accessing care. And so really we see this as addressing two important policy issues for the state: controlling healthcare costs and expanding access.
Okay, so when you say controlling healthcare costs, if we're losing revenue from what I call the hospital tax, I know that's not what it's called anymore, but you're the only one left paying it. So I guess we should call it the ASC tax.
Unfortunately.
Yes. So if we're losing revenue from, we get a lot of ASCs that right now are not pursuing access for Medicaid recipients or state employees, as the bill indicates. And we'll lose revenue in terms of, because there'll be a credit against the tax. So why would we support that?
Sure, you're offsetting the cost of that credit by your reduced exposure on the other side, right? It's less expensive to provide care in a surgery center. It's high quality, lower cost. And
so is the proposal net mean the state will come away paying less, even though it's losing tax revenue?
Sure, I think we looked at in past years when we've talked about this kind of proposal, we've done sort of an analysis and just shifting, a certain amount of care over to the surgery center setting more than outpaces the cost of the reduction that the surgery centers would see. So it's clearly, which I think is why we say it's a win-win, for the state and the patients, honestly.
So there's less tax revenue coming in, but there's less cost to the state in terms of the procedures that right now, those that are done in the hospital are costing the state much more for both state employees and Medicaid recipients.
Exactly. And I think if you look at the bigger picture also, we have a surgery center that last year, I think it was, lost $350,000. They had to pay $100,000 still, despite the fact that they lost money that year, had to pay $100,000 in surgery center tax. That center is teetering. And the minute that center closes, the case is returned to the hospital. A reimbursement in a surgery center across the board is 50% less than care in an HOPD. And so immediately you've added more cost to the system because you shifted that care back into the hospital. We have another center on the shoreline that's sort of deciding whether they're going to have to sell to a hospital because they just can't manage it anymore. That's a center that has done a fair amount of Medicaid in the past. They've had to reduce their Medicaid patients because of the tax implications. And so that's what we're talking about. We need to keep these lower cost centers viable. That center that I just mentioned is an independent center. That's another dialogue that we're having across the board about systems and providers being purchased and the costs associated with that. Well, we're kind of the poster child for it. We're doing a great job. We're the lower cost. We're getting taxed like a healthcare provider, taxed like a small business, and our reimbursements are 50% less. So
Lisa, I'm up against the clock. Could you just speak to what I anticipate will be, if not today, in spoken opposition and written opposition from the relevant agencies, in particular DSS, I'm sorry, what their position is, and apparently in opposition, and what your response is to that?
Sure. My understanding, I think we've talked about this in the past, is that the state does not access federal matching funds for the surgery center tax, unlike the hospital tax, right? The hospital tax was sort of a grab. We're going to reconfigure it. We're going to get some federal matching funds, and then we're going to shift that money back to the hospitals. This is not that. This is a straight money grab that keeps money out of the centers that would have been invested in technology, in staffing, and a host of other things. And so, that's one piece I think that's different, and whether or not it's subject to the tax implications, the concerns that the agency has addressed. We're very willing to sit down. I think, we've tried to talk to the Department of Social Services and look at ways we can be creative. I think there were concerns about the permissibility of the tax. I know in many other states, they have impermissible taxes that are still on the books, and they look at waivers and other ways to address some of those concerns. So,
thank you very much, Representative Metzgers.
Thank you, Chair Senator Von Farrer. So, as I understand it, we're still dealing with the 10% gross receipts tax. I thought we had reduced it. Are we still there?
We have a 6% gross receipts tax. And it was
and hold on, that was good. So the loss, basically, they were operating at a loss, but gross receipts were there, so they have a tax liability of $100,000, even though they've lost $350,000, because the tax is not on profitability; it's on gross receipts. Perfect. So you're asking for tax policy. I'd like to talk to you and wear my other hat, but I won't do that in front of Senator Von Farrer. I don't want to get yelled at. So I'd like to talk at some point about reimbursement structures between Medicare, et cetera, and the state. Because if we're driving business to the hospitals, that's ultimately more expensive. I need to understand why we're driving it that way, and whether there should be two parts to your ask. Whether part of your ask is to us on tax relief, and second is whether there's a creative reimbursement way that the state can save money on medical procedures done through these centers, right? Because why we're driving our medical dollars to the hospital system, which is the more expensive way, does frustrate me. So let's have that conversation on another point. But right now you're focused just on the tax policy. You're looking explicitly for tax credits to try to offset the lower reimbursement or the lack of reimbursement for certain procedures, basically.
So basically, I think this bill does exactly what you said you wanted to address, right? It is a creative way to address the reimbursement issue and incentivize centers, the lower cost providers, to provide care to those patients. And so really, it saves the state money in the end.
Okay. But it's not a proactive system in that it's a tax policy. It's not a statement on reimbursement, whether there is a way creatively to reimburse through the state to drive more of the business to a lower cost with lower cost medical procedures. I mean, we still haven't gotten to that, right?
Well, because
we're doing this on a tax policy.
Right. So the state is not going to increase Medicaid reimbursement, right? It hasn't happened for decades. And so this is a creative way to address that issue and create an incentive for sure.
Right.
It's almost like a default rate increase.
Right. But the Medicaid reimbursement is for the hospitals and not for yourself for certain procedures. My point is, I'm not sure why we're at 0 and 1 and somewhere else on the other. And so I'm not sure if we're allocating that reimbursement correctly.
Right. And I would just like to highlight, we're just trying to get back to where we were in 2015. And so that's the issue, right? It was like, we're going to take $16 million out of your industry. But this is a creative way to address a need that the state has and really work in concert and partnership to drive those cases to the lower cost provider.
Okay. Thank you. No further questions. Thank you, Senator Farrer.
Thank you, sir. Representative Cheeseman.
Thank you, Chairman Von Farrer. Thank you. And I'll be quick. How many ambulatory surgical centers are there currently operating in the state of Connecticut?
We have 61 in Connecticut and some in your neck of the woods.
And so with regard to, I know we're addressing the tax credits to be assessed against the tax for Medicaid patients. And I see that there are lots of theoretically federal issues. But I know one of the other things that was addressed was driving more people in the state employee healthcare network to ambulatory surgical centers. I know there are, if you get care in system with preferred providers, as a state employee, it's beneficial. Do you partner? Do you work with a comptroller to help become one of those preferred providers?
Sure. It's interesting. Several years ago, we started this dialogue with the comptroller's office. And at one point, I think that there was a list when it was Connecticut that I think provided the state employee plan, perhaps, they provided a whole list to state employees to actually utilize surgery centers for that very issue. I think there have been some changes in terms of bundling and other efforts with the comptroller's office that actually has eliminated the ability of some employees to use some surgery centers. So I think we'd like to continue that dialogue because absolutely we should be incentivizing that use.
Sure.
Yeah, and I think you actually, as a state employee, you might actually be given money for using these preferred centers because their outcomes are good, the costs are lower, and so on and so forth. Okay.
Smart shopper program or something like that.
Right.
Yeah.
All right. Thank you. Thank you very much, Chairman Farrar.
Representative Cheeseman, that's been a recent topic of conversation of how to get patients to be more engaged. When you remove, that's one of the problems with the insurance model, is that you're removing the patient from the calculation. It'd be like going into the supermarket and not seeing any prices. Well, you're going to buy the most expensive thing, or the thing you think is most expensive, even if you don't know, or you won't care either way if you're removed from it. And that just drives up costs, which is what we have. We have a system that inherently drives up costs.
Exactly.
Senator Martin.
Thank you, Mr. Chair. Lisa, the revenue that the current tax brings in, did I hear it correctly? It was 16 million?
I believe that is kind of in round numbers where we were. It was about 16 million. Mm-hmm.
Okay. And I just want to be clear, is the current tax that you're paying, is that on the gross receipts or is it on the net?
So it is currently structured as a gross receipts tax, which is obviously the most punitive tax that you can have. As we talked a little bit about implants and other things that are used, when a surgery center is reimbursed for those, which they're currently not reimbursed for under Medicaid, but under a state, under an insurance plan, you're taxed on that revenue and at 6%. So it doesn't even, and it's a straight pass through, right? You're reimbursed at the cost of what that equipment is. Like for a screw and a shoulder. Amanda, you might be able to speak to this too. And you're taxed on that. And so now your reimbursement for that screw or the other equipment, the graft, doesn't even cover the cost anymore because it's a tax rate on top of that.
So you're taxed on the reimbursement rate? Or
yeah, any dollar that comes in the door, the surgery center is taxed on gross receipts. Mm-hmm.
And if this was if you were taxed on the net receipts, how much revenue would that be to the state?
Okay, so it's interesting. It's defined as net revenue, the way it's defined in statute, net revenue but it's really gross receipts. There's no expenses that are taken out. I will say this committee actually kind of led the charge to make some additional changes to the tax. So it is presently a gross receipts tax at 6%. The tax is slated to be reduced in, I think, July 1, 2023. Which is terrific. It is currently the highest in the nation, and there are only like 4 states that even tax surgery centers. But it is on gross receipts, every dollar in the door presently. Medicaid and Medicare are exempt from the tax because in order to be a permissible tax, you can exempt government, you don't tax government payers. That's new though, relatively new.
But if we went to a net receipt tax rather than the gross receipt tax, what revenue would that bring into the state of Connecticut?
So you would basically be taxing only on sort of after expenses, I guess.
Correct. Do you know what that number
I don't. We can probably get back to you on that, but that's significantly less. I mean, like you look at the situation with the center I just described, they lost $350,000. So across the board, that's not the majority of centers.
But that's what we want not to have happen. Is if the way that we're taxing is not the right way regarding these centers, particularly if you're taxed on the gross and you're losing money, you're gone.
Right, and unlike other providers, that's the difference. We're taxed as both a healthcare provider through this tax and as a small business. So we pay property tax, we pay all of those additional taxes that a hospital doesn't pay.
Correct. All right. Great. Thank you, Lisa. Thank you, Mr. Chair.
Thank you, sir. Representative Meskers.
Yeah, just in relation to the last question, having looked at this closely, the gross receipts at 6% is generating $16 million. I think you should expect net profitability in the 3, maximum 10% region. You're probably looking at a delta of 16 million of taxes to $2 or $3 million of tax collection. So you're going you're going to basically give about 14 million, I would guess, of that tax relief. All right. Thanks.
Thank you. Seeing no other questions, Bree?
The next testifier is Commissioner Thomas Sadi.
Morning, Commissioner.
Good morning, Mr. Chairman. Just want to do a quick sound check. Am I coming through loud and clear?
You are.
Thank you. Senator Fonfara, Senator Martin, Representative Cheeseman, and honorable members of the Finance, Revenue, and Bonding Committee. My name is Thomas J. Sadi. I'm Commissioner of the Connecticut Department of Veterans Affairs, also referred to as a DVA. And I thank you for the opportunity today to address you. I also thank you for your service to our state and continued support of our Connecticut veterans and service members. As Commissioner and as an active duty veteran who still serves in the Army Reserve, I support the concept of that which is in HB 5478, and that concerning property tax exemption for certain veterans. That which it seeks to achieve, which is to provide additional property tax relief to lower income qualifying veterans. However, as I've testified in the past before the Veterans Affairs Committee, I generally do not support changes to individual sections of the property tax statutes throughout Title 12, but instead urge you and your colleagues to support the establishment of a task force to study and make recommendations for changes to veterans' property tax exemptions, abatements, and other similar benefits. This is the approach I've recommended in the past to the Veterans Affairs Committee, specifically last year, in response to several proposed veterans property tax abatement and exemption bills. Task force can conduct a comprehensive review of relevant statutes and make recommendations for consistent changes to those statutes. That is what SB 341, an act concerning property tax relief for veterans and members of the armed forces, would do if enacted into law. You know, the task force approach provides an opportunity with expert and public input, including input from veterans and municipalities, to determine whether exemption amounts established decades ago should be changed in relationship to current assessments of real and personal property. Additionally, there are often either overlapping or sometimes confusing exemptions, the clarification of which may benefit with a review to simplify and both the review and approval process for local tax assessors. The task force could also consider mandatory as well as permissive approaches, both of which are currently in the tax code, that provide municipalities with a baseline of veterans' property tax exemptions, but also a level of flexibility to adopt increased levels of exemptions based on local capabilities and or possible state reimbursements in lieu thereof. I thank you for your time, again, for your service to our state and veterans, and I'm more than happy to answer any questions members of the committee may have.
Thank you, Commissioner, and we thank you for your service, both to the state of Connecticut in your formal role and in your service continuing in your military service.
Thank you,
Representative sir. Borer.
Thank you, Chairman Fonfara, and hello, Commissioner Sadi. I appreciate the thought about having a task force, but don't we already have this information? Do you have this within your department as to like a comparison of what Connecticut veterans receive compared to other states, and kind of like a chart of, so we have an idea? Do we need a year-long study of this? Wouldn't we have this information somewhere?
Actually, no. The information does exist in disparate locations. It would require someone to go through and create a spreadsheet, to go through and do all the comparisons. Now that can be done. It requires staffing time. I don't necessarily think you absolutely need to have a task force. I think it's a matter of policy. In the past, there has been proposals to have the department itself conduct a survey of every municipality, of every abatement, every exemption for veterans in the state of Connecticut, do a comparison, and then make recommendations as to what should be changed in comparison to other states. I did push back strongly on that because I believe those are policy decisions that should be made by lawmakers. And then as commissioner, I shouldn't be making recommendations of specific changes to the tax code, except to say updates are appropriate. Now, someone, either the agency if tasked with that and hopefully would get additional funds or staff that would be needed to do it, could compare and go to each state and request those comparisons across the board. And then as legislators, you could look at them and make a determination, should certain exemptions be increased. That said, clearly, I think it's understood that the $1,000 base exemption, it's not a $1,000 exemption off your taxes, it's a $1,000 exemption off your assessment. So in Danbury, for example, where I live, that's maybe $30 off property taxes, which is de minimis. 30 or 40 years ago, that would have more of an impact. So I absolutely understand that these statutes do need to be updated. Where my concern is that any one person picking a particular section of the statute and not looking at them more broadly and deciding that overall these changes need to be made, and should certain ones be mandatory as a baseline and continue or expand the permissive ones. I'll give you an example. There are states that have hundreds of thousands of dollars of exemption for 70% or more or 100% service-connected disabled veterans. We don't have that in Connecticut, but I don't have a spreadsheet that has every tax exemption at the municipal level or the state abatements or payments in lieu thereof and comparisons across each state.
So thank you for that. So I agree, we should evaluate what we're providing for our benefits for our veterans. And I think we can always do more for our veterans. Do we need to understand though what each municipality is doing, or wouldn't we just need to understand maybe what other states have done that are best practices that we could emulate compared to what we're doing? And I do know the Office of Legislative Research has a lot of that information. Can we just start with comparing state laws to state laws rather than getting into 169 municipalities? Because I don't know that a task force will be able to do that either. I'm just trying to think of the best streamlined way to get this information in black and white so we can make an educated decision and what more we could do for the veterans.
We certainly could have that research done, or if it is done, just have it updated based on what may have changed in the last few years, since OLR may have done a broad review of tax abatements and exemptions in other states. And again, as a commissioner, as a member of the executive branch, I defer to the lawmakers as a matter of policy. What is it that you as lawmakers feel is appropriate for Connecticut to do, as well as looking at the fiscal impact and the impact on municipalities, and what benefit do veterans get out of that? And should it be a direct abatement? Should it be income-based? Should it be based on disability? Or should there be varied ones as there are now, and have those updated? There also are mandatory or requirements of municipalities, and there's also permissive sides of the statutes. Some states have permissive, some states have mandatory, others have a blend. So there is a little bit more than just a direct comparison of the amounts, but that could be a good starting place to look at what should be adjusted as the base amounts based on what other states do.
Okay, thank you. Thanks for the information.
Thank you, Representative Boer. Representative Kavros DeGraw.
Thank you so much, Mr. Chairman, and thank you, Commissioner, for being here today. I really appreciate it. Thank you for your ongoing service to us, and I know you have other important meetings on behalf of veterans this morning, so it's great to have you here. In terms of, approximately how many veterans do we have living in Connecticut? Because I think we need to sort of get a handle on that first.
So there often is a number thrown out of 200,000, but sadly, we are losing our veterans at a rapid rate, particularly the World War II and Korea War and early Cold War veterans. So currently, based on the most recent federal VA review, there's approximately 167,000 veterans that reside in the state of Connecticut. That does not include individuals who did not do 90 days of active duty service after their basic training. So you could layer on top of that individuals who are National Guard or reserve members who didn't otherwise have active duty, but they're generally not eligible for various veterans benefits. So anywhere from about 167 to maybe 180K in Connecticut.
Okay, and does your agency hear about veterans who are struggling to make ends meet or need help? I mean, is that something that people frequently contact you about?
My apologies. There was a bit of an echo in the beginning of your question, Representative. Could you repeat that?
Okay. Do you often hear from veterans in your capacity as commissioner in terms of making ends meet and how they might be struggling, especially to, along income lines?
Yes, I would say that it is the income-based concern. So veterans in general, particularly those who are of more substantial means, are not reaching out and saying, I should get this or my family should get this break. What is those who are more limited income. The other area that we see is where a couple, where one is a veteran and one is not, and they're receiving a benefit, and then the veteran passes, whether it's the husband or wife, then that the sustainability of that abatement or that benefit to the surviving spouse oftentimes is important because their income, the way they've lived, is based on that exemption. So we do get those, as well as there are inquiries I get and concerns about the low level of the baseline current tax abatements, the 1,000, the 1,500, and then the 500 on top of that for the 10% or more service-connected disabled.
Well, and I think that probably almost everyone on this call could say that they've heard them from veterans as well that live in their districts that are, advocating for the same thing. Your predecessor, former Commissioner Connolly, has submitted testimony that is supportive of this bill. And I guess what I would say is, he indicated that because there is no robust property, equitable exemption available right now, that while we all, I think, agree in theory on the task force being helpful, that, because veterans, and especially right now with the economy being the way it is, that basically they need this exemption now to really make a difference in their lives now. So I guess, what would you have to say to that?
Of course, particularly veterans with lower income who are trying to stay in their homes, of course, would benefit from an increase in any abatement or exemption.
And I guess, when I'm looking at the numbers, because this has an approximately, $26 million note on it to reimburse the towns that are below the $150,000 equalized grand list amount, that comes out to 0.9797% of the annual budget of the state of Connecticut. So, in terms of burden to taxpayers, I think often about the burden that people like yourself have borne on our behalf as citizens to serve either in wartime or peacetime on our behalf. And so I do understand the task force piece, but I do hope that we're able to pass this out of committee because I think it's a really important step forward for our veterans right now. Go ahead.
Thank you, Representative.
Thank you so much for your time today, Commissioner.
Representative Borer.
I'm going to defer to Representative Iaccarino and then go because I've already gone. So
that's all. Thank you so much. I'm going to be very quick.
Representative Iaccarino.
Thank you, Mr. Chair, and thank you, Commissioner, for being here and advocating for our veterans. You've done a tremendous job with that. I know firsthand. So I do think it makes sense because it gives clarity and continuity, I think, to municipalities. Yes, it's a cost to the state, but I don't know if people realize how much veterans do for the community and not just the country, for the communities, how much they give back. And many times, unfortunately, they do struggle and every little bit helps them. But I think the 10%, it gives clarity and continuity, to the municipalities. What I don't understand is why our congressional delegation doesn't advocate and fight for greater dollars for our veterans through the federal government to the states for block grants, which is similar to what this bill, the way I read it, is the 10% abatement. Is that correct, Commissioner? Not the federal side, but the state side. And then we can talk about the federal side another time.
Correct. If I understand your question correctly, Representative, and thank you also not for your service to the state, but also your service in uniform as a veteran now, that this is property tax abatement. It is not related to any federal tax, and there is no federal block grant or federal funding to offset these costs.
No, I get that. Excuse me, I have a terrible cold. It's not cold, but it's just a horrible cold. No, and I think it makes sense because it gives continuity. So many times municipalities don't, even though we have permissive language in the past, they don't really, veterans are the conduit in the community. They don't know the percentages. And I think this gives more continuity and clarity. But another point, it's another conversation. I really think our federal delegation and federal government does a horrible job when it comes to our veterans. That's just my personal opinion. I don't think they advocate enough for them. But I think there's something we really should look at. I think it makes a lot of sense.
Thank you, Representative.
Thank you, Commissioner. Thank you, Mr. Chair.
Representative Borer, are you still interested in?
Yes, I am. Thank you, Senator. I just wanted to add briefly that if we do move forward with the task force, just to a previous point, we want to add that we don't just want to study the veterans, but the surviving spouse as well. I hear from so many widows from veterans. They've given the ultimate sacrifice, and they are struggling as well. So anything we move forward with on studying and evaluating benefits for veterans should also include the surviving spouse as well. Thank you.
And thank you, Representative. And one other point, if I may, Mr. Chairman, through you, just a statement to the committee is that moving forward, potentially with this bill or other bills which address particular issues of abatements or exemptions for veterans, doesn't need to be mutually exclusive from also having a broader study and looking at these abatements going forward for future legislative sessions.
Representative Butler.
Thank you, Mr. Chairman.
You are on mute, sir.
Thank you, Mr. Chairman, and thank you, Commissioner, for all of your service to the state and in your military capacity. I've listened closely, and I agree with your assessment that we need to take a holistic approach and see how we could address, this on a, on a level that we could, pretty much capture all the needs, just as you just talked about. But I could tell you that from the veterans in my district, there is a need to address their economic situation now. We talk about what they need in terms of tax relief, but what we don't realize is the health issues that many of our veterans have that is causing a big dilemma on their economic situation. We have veterans that have chronic health situations that they have to deal with. And as they're aging, as you know, we need to provide some help now because a lot of them don't have the capacity to earn more income because they're on fixed incomes. So while we actually take the time to have a task force, I truly believe we need to do something now. In my district, I know too many of them that are having health issues that is just, blowing their monthly budgets out of the water. So we need to help them now. So thank you for your service again. And I just wanted to put that out there because I don't know, the number of veterans that we have out there divided by the amount of municipalities that they live here, I think that we could do something now to actually help them. They put their life on their line. They served their country. We need to do something now. Thank you, Mr. Chairman.
Representative,
Commissioner, go ahead.
Thank you, Mr. Chairman. Yes, I agree. And that's why I stated earlier that potentially proceeding with this bill or other bills does not have to be mutually exclusive to from a task force. Also, just more broadly, looking at other areas of potential relief for veterans who don't own real property. So not every veteran owns property who has limited income who could benefit from an exemption or an abatement. And along those lines, Representative, and for others, when it comes to healthcare, I know stepping a little bit out of the right and left limits of the committee meeting here, but please, any veterans who may be eligible for federal benefits to please reach out to the State Department of Veterans Affairs and our veteran service officers to see if we can either increase their eligibility if they've already registered or as greater service connected disability rating, or if they're not connected with the VA, we can check and see. All too often, there are veterans out there who may be eligible because eligibility standards have changed and expanded. There's more presumptive conditions, and at least maybe we can get them connected with federal VA healthcare benefits or service-connected disabled payments to try to help them. Thank you, Mr. Chairman.
Thank you, sir. Bree.
The next testifier is John Carl Casa.
Thank you. Thank you, Mr. Chairman, members of the committee. My name is John Carl Casa. I'm President and CEO of the Connecticut Community Nonprofit Alliance. We are the statewide organization representing community nonprofits who serve more than 500,000 Connecticut residents each year and employ 115,000 people. We are here to ask that you amend HB 5476, and we urge you to add language to Section 1 of the bill to exempt nonprofits from the new municipal taxes for stormwater. Let me just take a minute to talk a little bit about where nonprofits are right now. They were at the beginning of last year, as you've heard over the past several months, they were $461 million, 28% behind inflation since 2007. The last 2 years have been hit by COVID, which exacerbated the impact of inadequate funding. It brought unanticipated and unbudgeted costs. They were, and we are, very appreciative of the 4% increase COLA that was passed last year by the General Assembly and signed by the governor. And then over the past year, 6% inflation has eaten that. Now they find themselves in the midst of a workforce crisis, the likes of which they've never seen. 91% of them have told us that they are finding it difficult or extremely difficult to hire people. Their vacancy rate is approaching 20%, and 59% of them have waiting lists. So I just want to let me be clear, although the statute calls it a fee, the stormwater assessment is a tax. It's a tax on otherwise tax-exempt organizations, and nonprofits have been exempted from governmental taxes for a good reason. They provide services in their communities so the government doesn't have to. If nonprofits aren't there to address community needs, the responsibility would fall to government. And government is often the respondent of last resort, and it would be most often at a substantially higher cost. Many community nonprofits have contracts with the state to provide essential services on behalf of the state. Require them to pay taxes to municipality means a portion of the money appropriated by the state through the hard work of this legislature and its appropriations committee would then have to be paid back to another level of government. State contracts, just to note, the state contracts do not—
30 seconds, please summarize.
Okay, I will. This is not, let me just point out, this is not a sky is falling worry. It is already happening. In many ways, people assume that nonprofits will continue to provide the services they have over the years. That with a 59% of respondents say they have waiting lists, I think we can say safely that that is not happening, that our system is cracking at the local level. Community nonprofits are having difficulty responding to their communities, and siphoning off the revenue in this kind of a tax would only harm the people who depend on their services. Thank you.
John Carl, it's always good to see you.
Good to see you.
And I hear everything you're saying. The committee hears everything you're saying. But there is another side to this story, and I know you know that, and all the hats that you've worn over the years, that government doesn't, well, the federal government may print money, but the state does not print money, and towns don't print money. And that balance is critically important, because there's no free lunch as it comes to how there are a lot of towns in Connecticut that do just fine. That's the beauty of Connecticut. The other side of that is there are some cities and towns that don't. Mm-hmm. And I think you know that a number of the nonprofits in this state, if you had a map, you'd see an overwhelming percentage located in many of those communities that have the least in terms of property tax revenue to offset these costs. So that's the rub, and that's why it's not always so fun being a legislator, because you have these conflicting concerns that we recognize on both sides. So in listening to you, you certainly present a strong case for one side, and those of us who represent areas that struggle, just as nonprofits struggle, municipalities struggle, and trying to figure out how to balance those, the needs and the obligations is not always easy. But I thank you, sir, and Representative Cheeseman has a question or comment for you.
Thank you very much, Chairman Fanfara. Good to see you, John Carl. As my understanding in the legislation last year, hospitals were specifically exempted. And I'd just like you to comment on that, because as worthy as the work hospitals does, you and your member organizations do equally worthy work. We're constantly talking about picking winners and losers. So I'm just asking for how you feel about this piece of the legislation.
No, I think more, I don't want to, of course, hospitals do valuable work. And so I'm not questioning that or questioning the correctness of exempting them. But I think what exempting them does, because they're exempted by from taxes, according to their agreement with the state. I think by exempting them, the General Assembly has acknowledged that this is indeed a tax. And so it's a tax on in our case, on community nonprofits that provide different kinds of services than hospitals do.
Right, and I will add that, you know, obviously the community nonprofits are providing those essential social services, but your nonprofits do not consist only of social service providers. You're representing all the nonprofits in the state. And I imagine a lot of them, you know, small museums, larger museums, all of those, again, would be subject to this stormwater runoff fee. And again, many of them have seen, you know, dramatic reductions in income, all the commensurate things that go with the pandemic. So I'd just like you to comment on how the other members of your alliance may be.
The other members are by and large small organizations, and they struggle to keep their doors open. They are fighting each year against the tide of increased costs and difficulty in attracting and retaining employees. I think what we're talking about, and you know, when the stormwater law was passed, it was a federal mandate. I was working on behalf of municipalities at the time, so I understand how this cost was imposed by the federal government to the state, and then by the state down to municipalities, and I understand that the Stormwater Authority legislation is intended to shift that burden a bit away from the municipalities. But I think it illustrates what the policies have been at all the levels of government. And that is often looking at the ones who are least able to shoulder the burden. In this case, cities and towns, urbanized in particular, those in particular are facing stormwater compliance burdens. And it would be, I think, just exacerbating that kind of really unfair situation to say to nonprofits who are either small and struggling to keep their doors open, or who are social services providers treating or dealing with folks providing services to them, who are those who are the most vulnerable in our state, to pass on the cost to them, I think would be compounding the error that the federal government has made in passing these costs down to other levels of government.
Thank you. Thank you for sharing your thoughts today. And thank you, Chairman Fanfara.
Thank you.
Thank you, Representative Cheeseman. Seeing no other hands, Bree.
Thank you.
Thank you. The next testifier is Rita Mcdougall Campbell.
Good morning, esteemed members of the Finance, Revenue, and Bonding Committee. My name is Rita Mcdougall Campbell. I'm a retired administrator residing in Trumbull, and I'm an active member of CEAR, the Association of Retired Teachers Connecticut, and the Greater Bridgeport Retired Teachers Association. Today, I'm submitting written testimony in support of the following bill, if language can be amended to support more favorably all retired educators who depend upon TRB for their health insurance benefits. SB 442, an act increasing the amount of the Teachers Retirement System health insurance subsidy. I would like for the language of this bill to be amended to include the following provision: that in addition to the increase in the subsidy for those educators who, because they are ineligible for Medicare, must purchase their retirement medical insurance through their last employing Board of Education, that the 1/3 subsidy that is currently applied only to those retirees who are enrolled in the TRB Advantage Insurance Plan be also extended to apply to retirees who choose the more extensive healthcare protections that are provided by the traditional Medicare supplement plan. The proposed change would help to level the field for all retirees enrolled in TRB medical insurance plans. For example, in 2022, the monthly premium of the Advantage plan is $80, while the monthly premium for the traditional Medicare supplement is $319, a disparity of $239. Additionally, with the change in the administrator from Anthem to United Healthcare, the 2022 premium for the Advantage plan decreased from $125 down to $80, while the monthly cost for the Medicare supplement increased from $228 up to $319. Having the 1/3 state subsidy applied to both plans would help make the comprehensive supplement plan more affordable for those who depend upon the security that comes with the unimpeded delivery of service that traditional Medicare provides. No restricted networks, and no prior authorization to delay necessary medical treatment. I hope the Finance, Revenue, and Bonding Committee will take this amendment under advisement and will vote in the affirmative to add the proposed language to SB 442. Thank you for your consideration.
Thank you, ma'am. Senator Martin has a question.
Thank you, Mr. Chair. Thank you, Rita, for testifying. So, Rita, what you just stated, did you submit that to us?
Yes, I did.
In testimony?
Yes.
I hadn't seen that, so I'd like to take a look at that.
Okay.
What the implications are.
And if you have any, I'm sorry, if you have any questions after you read the testimony, my contact information is also available, so please reach out to me.
Perfect. So the bill addresses teachers that were not qualified for or never contributed to Medicare originally. Can you tell us what year that changed?
I believe that was 1986. I don't have that in front of me, but I believe that change was 1986. But it also includes anyone who retires prior to becoming eligible for Medicare. So for example, a person who retires prior to reaching the age of 65, they may have 35, 37, 40 years, but may not be 65 because they haven't reached Medicare age. They too will go on to the Board of Education plan until they reach Medicare age. But there is another group of people who never qualified for Medicare. So unless they're able to join in through a spouse, then they will always have to find another way. And most of them will stay on the Board of Education plan.
So in 1986, prior to 1986,
I believe that's the year.
They never contributed to Medicare. So the state helped subsidize them to pay for their health insurance that they paid through their Board of Education, correct?
Right. Right now, the subsidy is $110,220. And it's been at $110,220 for decades.
And what do you mean by 110? That wasn't that the original amount? And what's the 220?
The 220 is
isn't that the current amount?
Well, it's 110 for one group and $220 if it's a combined, if it's a husband and wife, or if the person then goes to, becomes of age, then they also receive the $220. I believe what this plan is asking for is an increase to $350, and there's another proposal that has another amount. But this plan, I believe, is asking for an increase from the $110, $220 to $350.
What you just said is that those that retire prior to age 65 would, if they want to have health insurance, they can still purchase it through the Board of Ed. However, and they would be subsidized with,
100. I believe it's $110. I, for example, was in that category prior to becoming eligible for Medicare, and the subsidy at that time was $110 a month.
Okay, and how much currently is health insurance? Do you know, for a single teacher? I'm assuming it's only for a single retired individual, let's say 65, who's hasn't reached 65 but is retired. They're purchasing a single healthcare.
I believe that they could be purchasing for themselves or for their spouse.
They can. And how much is that for a single and a spouse?
Well, if it's prior to Medicare, it would depend on the Board of Education.
No, I'm talking about currently, right? Currently, this plan is still in play. And if they retire before age 65, they can get subsidized by the state. How much is what is the average cost of health insurance?
As I said, I believe it depends on the Board of Education. I believe each Board of Education sets the price. And I've been retired now 7 years, so I'm not an expert on that. So I'm not testifying as an expert. I'm testifying as a retired administrator who receives benefits through the Teacher Retirement Board.
30 seconds, please summarize.
All right, thank you, Mr. Chair. Thank you for testifying, Rita.
Thank you, Senator. Seeing no other hands, Bree.
The next testifier is Rick Melita.
Good morning, members of the committee. My name is Rick Melita, and I am the director of the Connecticut State Council, the Service Employees International Union. I'm also here on behalf of Recovery for All, a statewide coalition of faith, community, and labor organizations united to eliminate systemic inequalities and rebuild a better Connecticut. I'm here to support Senate Bill 443, an act concerning the tax incidence report. Tax incidence is an estimate of the total tax burden placed on residents. It includes both taxes filers pay directly and those that are indirectly shifted onto them by businesses through higher rents, consumer prices, and fees. Connecticut's first tax incident analysis was done in 2014. It found that Connecticut state and local taxes, I'm sorry, I lost my place in there. That Connecticut's state and local tax system disproportionately impacts low and middle income earners. The 2022 report shows that low and middle income taxpayers have lost ground since 2014, despite using different criteria, which may underreport the regressivity. This tax disparity impacts SEIU members in two ways. One, a bigger chunk of working and middle class income is taxed in order to avoid having the richest pay what they owe. And secondly, it creates a false scarcity, imposing a lower budget ceiling that limits providing healthcare, paying for dignified retirement or needed services for the elderly, children, providing decent housing, transportation, or cleaning up our environment. Having clear guidelines on how to conduct an apples to apples review of whether the Connecticut's tax system is transparent and whether it's becoming fairer or not is necessary. The purpose of a tax incidence report is to provide lawmakers with historical data to enable reasonably accurate forecasting and inform taxpayers. Finally, I'd like to address something that came up in my last testimony before this committee, where there was some exception to how I characterized billionaires becoming richer during the pandemic, that it was inflammatory to say that they seized billions. Writing my testimony prior to that, I actually did pause and consider if it was appropriate to say that. And I'll admit it's true that these fabulously wealthy don't hold up convenience stores at gunpoint to attain their wealth. But I would remind you of a quote from Anatole France, who said, "The law in its majestic equality forbids rich and poor alike to sleep under bridges and to steal their bread." If the French author was alive today, he might also say that the law provides the rich and poor equal opportunity to hire lobbyists and accountants who specialize in tax avoidance. The rich can, have, and do game the system. In our late stage capitalism, wealth is transferred to them either directly or indirectly with the stroke of a pen. I'll also quote a recent article in the Hartford Courant, where it says, Ray Diallo, who's the richest person in Connecticut, has found fault with capitalism, telling an audience at the annual Greenwich Economic Forum in November 2019 that the US economic system does not work for the average person and needs to be fixed. Let that sink in for a second. He earns $22 billion. And even he realizes that this bill by itself won't address the systematic unfairness, won't fix the economic systems to make it work for the average person, but it is a meaningful first step in order to do so. Thank you for this opportunity to testify.
Thank you, sir. Seeing no hands, Bree.
The next set of testifiers will be going as a panel. We have Commissioner Mark Fountain from the Department of Revenue Services, Deputy Commissioner John Biello, and General Counsel Lou Bakari.
Commissioner.
Well, thanks everybody. Can you hear me okay?
Hear you fine.
Terrific. Good morning, Senator. It's great to see you as always, and appreciate all of your hard work on behalf of our state, Representative Scanlon, all of our ranking members, and distinguished members of the Finance Revenue Bonding Committee. As you know, I'm Mark Fountain, Commissioner of the Department of Revenue Services. I'm here with Lou Bakari, who's our Senior Counsel, as well as our Deputy Commissioner, John Biello. I did submit testimony on our bill, which is 5473, the legislative proposals. I'm not going to go through each one of them unless you have questions, and between the three of us, we can get the answers to you, but they're highly technical. Many of them are minor adjustments to help us reflect to today's economy. So we're certainly available to answer those. I didn't really want to spend a lot of time on them, but obviously if you have concerns, questions, of course, we'll address those. You know, in recent days and weeks, the impact of taxes has been on sort of a lot of people's minds, and they are, you know, concerned. As you've heard from some of the previous testimony, we have issues with gasoline, obviously, going through the roof. Taxes are being paid now, as our closing date is April 18th. And so it's important, I think, that we consider not just the details of any one specific proposal, but look at how any proposal fits in with the state's overall tax policy. And what you do, which is develop tax policy, is not easy. And to this extent, the committee would find it helpful. Our team at DRS, as you know, is always ready, willing, and able to meet with you, meet with the committee, meet with individual members, meet with the public to discuss our thoughts. But we do recognize at the end of the day that tax policy is decided here in this committee, then ultimately in the General Assembly. With that set in mind, I would like just to mention a couple of items that we may have concern with or might need some modification. But again, I just want to emphasize that we're willing to work with you to get the goals of the committee and those who have proposed these particular bills accomplished. Section 32 of House Bill 5473 is probably the one thing in our bill that is something I've spoken to Senator Fonfara about and some of the other members of the committee. I'm seeking legislative authorization to provide the department with the ability to sell its outstanding tax debt. You know, when I took this job as commissioner, I thought that was ongoing practice, and I was surprised to learn that we don't have a provision in our statute that allows us to do that, although municipalities have been authorized for decades to do this. And I implemented a program in Danbury that was incredibly successful that also sold our tax debt for as well. I just want to be clear that, you know, we're not asking that we're just going to pull anybody off the street and sell our debt. You have to be a registered collection company within the state of Connecticut to be able to do this. We also like the ability to be able to hire outside attorneys in other states. So somebody has a big liability to Connecticut and maybe they move to Florida. we want the ability to be able to go and get the money that they owed before they left us. We are going to be using a bid model and applications for from companies to be able to do this. It will take several years, although I have tested the market with informal conversations about the appetite, and there is appetite, but we have, as you know, a lot of aging debt. Right now it stands over $1 billion. It dates back to the mid-90s. Some of it is worthless and other debt is absolutely collectible, and we should be doing what we can. Now, the problem for us in our agency is we just don't have the horsepower, and we could never hire enough horsepower to chase a lot of this debt across the country. And that's why bringing in an outside vendor to help us do that is really important. And let's just be clear, they buy the debt from us. They buy it from us. So once they purchase a debt, it's their problem to go out and collect it and to make it worthwhile. So it's a great program. I understand some of the reticence people may have, but understand they generally will mail a letter. It's usually their process. And they actually spend a lot of time trying to find where people went, or if their LLC change names, which is often a tactic to avoid taxes, they can do that. I also want to quickly mention, I have some other concerns I have listed out. We are being asked to do 7 studies at one time in DRS by my legislation and your legislation. So if we could align that and spread that out over a longer period of time, and I can work with the chairs on that. And then finally, I'm concerned about provision in 443 that opens up 12-15 for federal data. I think there's an issue there that we should really discuss, but I also understand that the committee wants certain data, and I think we can probably find a balance to that. So with that, I'll open up for questions. I don't want to overextend my time here. Thank you.
You're on mute, Senator.
It'll be helpful.
There you go. Oh, Senator's still on mute.
Is going on here. All right.
There you go. There you go.
I think it was my first day on the job. Commissioner, I was saying that I very much appreciate the team that you have there. Very good folks to work with, including yourself. With respect to the sale of the owed taxes and the liens, there's questions being asked of us about why go outside to do that? Why not have folks internally hiring more people to do this work? Can you comment on that?
Sure. We do that. That is part of, as you know, part of our function. The problem is that if it remains uncollected, that debt gets older and older and older. So we have to prioritize newer debt to be able to go after that. And there is a process for writing off debt, because some of it is uncollectible. It's not worth anything. There is a process to do that, but unfortunately, it's hard for elected officials, the controller, people like that to do that because there's a stigma that goes with that. It's hard for commissioners to do that. There's a stigma that I would have for writing off debt. This allows us to be able to easily collect the debt without having to take on the load of more employees. So if you put our debt of $1.2 billion in tranches, the very top piece of that debt, not a few years ago, I'm talking about 10 years ago, could be worth as much as $1 for dollar. We would get paid $1 for dollar on that debt. And then as it gets older and older, it gets less and less of value because it's harder and harder to collect. And it would be 50 cents on the dollar or 10 cents on the dollar, but it's something, right? It's less than what we have. So do we want to go out and chase a $600 tax bill that's going to end up paying $60 for us? No, but somebody will buy it straight up and go do it themselves, and they'll make a few bucks doing it.
And I think that your initiative here is an important one, and I support it. I think I'd like to think the majority of the committee would as well. For me, the issue is, and I know I'm not the only one in this, that if we're going to, and as you said, you're surprised to learn that this is not a policy that has been ongoing, that would, and I would assume you would like to see this be ongoing. That would suggest that having a team of folks that are part of DRS that would be doing this on a regular basis, as opposed to going outside and hiring private contractors to do the work. I don't have any quarrel personally with your initiative. It's about who would do that, and if we can have folks who are under your control doing that, it seems to me that might be a better, more efficient way of operating. But I'd like your perspective on that.
Yeah, so these companies generally look at what is the value of the debt that you have in front of you, and then they'll make decisions. They may not buy all of it. They may not like some of it, and that would revert back to us, and then we would have to go and write that out. I don't think we could staff up enough people to do that. I think that, you know, our auditing team, oftentimes audits take 18 months to 2 years. They don't do a lot of straight up, you know, small dollar volume collections, because it doesn't pay. If they've got somebody who might owe us $1 million, if somebody owes us, you know, $100, they're going to go after the $1 million, and rightly so, right? We want them to use their resources where they're best at. But to staff up to do this, would, you know, we would need at least, most of these companies are 70, 80, 90 people. They spend time finding out where these people are. It's a little bit of detective work, a little bit of, being able to leverage the resources that are readily available in the public domain. We're just not geared to do that, and neither are municipalities. That's why municipalities do the same thing. They sell their debt. They don't try to staff their way out of it. So I think at the end of the day, you would get a better return on that money than if you budgeted me another couple of $1 million to go chase it, or we'd have somebody pay us, $500 million for all this debt and not have to do anything. I just think it would make a lot more sense. But I'll certainly defer to anything the committee wants. You know that.
I'd like to have further conversation with you about it. But in the meantime, as no surprise, you have several hands and questions for you, Commissioner, beginning with Representative Cheeseman.
Thank you, Chairman Pumfar. Good to see you, Commissioner. So with regard to the outstanding debt, what percentage would you say is uncollectible?
Great questions, Representative Cheeseman. This is a strict guesstimate. Probably about 20 to 30% generally in those bills you'll see are just, you know, somebody's passed on, or there might be a different, there might be a business reg why they don't have to pay, and that's been in dispute. So it's about 20 to 30%, I would say, is a fair guess.
Okay. And at what point, and I presume this is set by statute, do you write it off?
I'm going to defer to Lou Bakari on that. I think the number 10 years was where we wanted to go. So we would keep the 10 year, and I didn't mention this to Senator Pumfar, so I apologize, Senator. Essentially, I thought, you know, we were going to keep the debt up to 10 years and try to collect it internally. Once it hits a 10-year mark, we would then put it in a tranche to be able to be bid on by companies that might be interested in it. But Lou, do you just want to opine on that for a second?
Sure, I'm happy to, Commissioner, and good morning, Representative. To your question, is that there is a statute that prescribes essentially that after the department makes efforts to collect, whether it be tracing down assets, whether it be conducting searches to determine whether people own land, property, things of that nature. So there's a series of things that the department goes through. Once we've determined and we've exhausted all of those statutorily prescribed steps that we have to take to collect it, we're allowed to place a debt in what is called the state suspense book. And once it's placed in the state suspense book, it's after 7 years that debt can be written off the state's books. During that 7 years, if something came up, if someone won the lottery or we found something else, we could certainly go back and collect. But the answer to your question is, once it's placed in the state suspense book, the debt after 7 years is deemed written off, uncollectible, and the state can write it off its books. And I think that's one of the things the Commissioner was alluding to, is that there's a series of potentially conflicting statutes as to when that write-off will take place and things like that, which kind of make this whole area a little gray. And so what I think the department is proposing in combination with selling its debt is also proposing a 10-year statute of limitation on debt collection. So when you put these sort of things together, it's the goal of cleaning up what this old debt might be, giving clarity moving forward, and providing the department with potentially another revenue source. So that's sort of a combination of the things that are in our bill. But to your question, 7 years is the general rule.
Okay. And are there other states who in fact sell the tax debt? And if so, what, you know, what sort of bids do they see? How does this play out elsewhere? Is it, or would we be a revolutionary here in doing this?
Not revolutionary. It's a fairly common practice out there.
Tagline?
I wish I could say it was only my idea. What I do think is unique is the sheer volume of money in that suspense list, and that's really where I'm driving at. That's where your value is. That right now has no value to us because we're still working on the other 7 years worth of back debt owed. That does have value to companies out there and to people that might be interested. So I can get you a list of states that do similar kinds of things. Everybody does a little bit differently, but I'll have to leave.
I'd be interested to see that, and typically what the return is on. And okay, I think that's enough on that point. 5473, I think lines 188 through 314. A big section on special police peace officers. Is this to bring your special police into compliance with the Police Accountability Act? It seemed to be somewhat of an outlier in a DRS bill.
Yeah, it's an odd provision. It is to bring us in alignment. We have sworn officers that work for us. I'm going to turn this over to Lou Bakari because he deals on a day-to-day basis with that team. So Lou, if you just want to fill in the blanks for Representative Cheeseman.
Very, very simply, no, Representative, no, it is not anything to do with the police accountability bill. It was this
30 seconds, please summarize.
Proposals was in front of this committee last year, and it's the same proposals that are back this year. It is just for consistency purposes. It's similar to a change that was made for Department of Motor Vehicles last year. It's to bring our officers within the definition of peace officers within the state of. So that's the entire purpose behind it.
Well, I remember we had a similar bill last year. Okay.
Correct.
Last quick question.
That's the one.
443, 125 to 132, which would theoretically give chairs, ranking members, legislative leadership access to individual tax returns. And I may have to swoop back on this one. That gives me a bit of concern here.
Yeah, so I did touch on that in my remarks briefly, Representative. We have the agency definitely has concerns about this as well, without disparaging anybody out there. This protected data is protected for a reason. If you pull that data, you run the risk of a liability issue. God forbid if any of that information got out into the public domain. There are social security numbers on there, email addresses, and really it undermines the whole system of full disclosure. So when somebody fills out those tax documents for us, they trust that they're going to be completely honest and that their information isn't going to be spread all over the internet. And unfortunately, that's what happens. There's also a liability issue for the person that requests this stuff. If for some reason or some way that information should leak out, and for people that make a lot of money, security is a big issue. Somebody could get hurt. Something could happen to them. And there also could be business liability for the corporations that may have data or information that is proprietary or unique in their filings. And that's again put out in the public domain. It's a challenge for us. So we don't want to undermine the trust, and we certainly don't want private information becoming public. But I have heard from the committee that they want more data, they want more information. I think we can sort of meet somewhere in the middle to get this information out there while still protecting our data. And then the last thing, 1215 is written in such a way that it allows us to get IRS information. If we amend some of the portions of that piece of in this bill, we may be shut down from getting specific IRS information because they have federal laws that say you can't get this information. So I think there's some way we can meet in the middle here to satisfy those individuals that are looking for some key information, but without potentially sharing anybody's private data.
Okay, and I know I've exceeded my time, but I would be extraordinarily concerned were this to remain in the legislation. So thank you very much, Commissioner Boughton. Thank you, Chairman Fanfara.
Thank you, Representative Cheeseman. Shift change. Representative Mesker is followed by Representative Farrar.
Thank you very much, Chairman Scanlon. Commissioner, I would echo the concerns on the confidentiality in tax data. I think aggregating data on the top end taxpayers is certainly, in terms of tax policy and economic policy, is valuable information, but I would be loath to see individual data too far disclosed. We're a citizen government with people in and out too often and too frequently. I wouldn't want the data in wide circulation, knowing that the state would have liability. Could you clarify a little bit the tax collection policy? So I'm trying to understand the 10 years versus the 7 years in terms of, and when you're considering either writing off debt or versus selling the debt. So uncollectible liability based on tax.
Sure. So the way we see this working is that DRS would have responsibility through the 7-year period. And then at the conclusion of 7 years, that would enter into the suspense list. At that point, we would be able to go out to the market, see if anybody's interested in purchasing it.
And then the
so
supplemental
we own it.
10 more?
7 years. No, it would be inclusive of the 7 years, unless Lou, I'm wrong about that. But that's
so basically, you're thinking 7 years in terms of the state's active collection, 3 years potentially sold for collection. After 10 years, we would write it off. Is that kind of what we're talking about?
I don't believe so. Lou, you want to just clarify that?
To. And I apologize for the confusion, Representative, that I may have caused. I think that these are intended to work together. Currently, as things currently exist, something is placed in a state suspense book, and after 7 years, as I described, that is when, and before it gets placed in the suspense book, it could be many years that we are trying to collect. It could be years and years and years before we actually place something in a suspense book. We might have found some assets, we might have found a payment plan, things like that. But eventually we've run out, we've exhausted our ability to collect. And once we've done that, then we can certify that and place that in the suspense book. And that's when 7 years kicks in. What the commissioner is proposing is sort of a comprehensive reform, is that we would get rid of and clarify this 7-year suspense book, the write-off provisions that are provided. There are certain committees that come into play to write off debt. It is really unclear what the commissioner is proposing, so we don't wind up in a place where we have such old debt anymore. We're saying let's wipe it across the board, forget it, and this new 10-year statute of limitations would come into play and take care of everything, that any debt, no debt could go beyond the 10 years that we'd have to collect it. So it's current state versus what future state would look like. And in that future state, there would be no 7-year suspense book. It would be straight 10-year collections, which would match the IRS.
Okay, so basically after 10 years, the debt is written off and the statute of limitations takes it under the new law.
Precisely.
Okay. And so in the current environment, what I'm hearing is you've got a mishmash of uncollectible debt that's gone into suspense that now you're thinking of putting out for sale.
That's right.
Was the decision to go to sale versus to allow a commission-based collection structure, why was it done that way? Given the fact that we have no history of third-party collection, I assume that the agencies are going to lowball us on the pricing of the debt. And the question is, why are we not putting it out on a success basis where they get 10 or 20% of the proceeds versus they're going to pitch us at a price point, hoping that we've underestimated the collectability?
I think that's one way to do it. I've had experience with both. Both have their pluses and minuses. I would try to, I just don't have enough authority to really dig deep in this. I did have some very informal conversations just so I didn't want to come to the committee if there was no appetite to do this.
Yeah, my personal suggestion.
I don't think we'll. Yeah. No, go ahead. I'm sorry, Representative.
That's right. Commissioner, my personal suggestion is I create 2 pools randomly in terms of similar time frames, similar amounts, put one out to a percentage collection and put one out for a bid for final sale. and see what the recovery rates look like. So you get an idea of collectability. Because I'm concerned you might be, you know, these guys, this is not a charity business. I'm wondering how they'll price it.
Me too.
Okay. Having been on the other side of the fence, not in that business, my assumption is they'll price it at 5, expect recoveries at 10. So I'm not sure how we build the success ratio, or we get maybe two different pools, like one on a commission, one on a cash sale. You might want to look at that. All right. But thank you very much for all you do.
We do. I just want to be clear. We do use outside collection agencies. So I just want to be clear. Currently in our current state.
But do they purchase, or do they work on a success basis?
It's success fees, yeah. But it's not like this. It's not like what we're trying to put together here.
Yeah, and so my only thought is that we're going to be selling without recourse back. So if they purchase at 5 and get 30 cents, it's theirs, right? So not knowing how the risk pool looks like, we may want to look at splitting part for clearance cash sale, 3 for certain section for collection, with a success fee. All right. Thank you very much. Sir.
All right. Next up is Representative Farrar, followed by Representative Piscopo.
Thanks, Chairman Scanlon. Hi, Commissioner and General Counsel. Thanks for being here. Nice to see you again. Following up on my colleagues a little bit on this tax gap discussion. I know you clarified, thank you, the difference between kind of the 7 and 10 year question, which was very helpful. Kind of getting to the heart of that though, do you have any analysis of what our current tax gap could be?
Our current tax staff, you mean our auditors?
Excuse me, tax gap. So the gap in elections.
Oh, our tax gap. Yeah, I'm sorry. I didn't hear it. Yeah, tax gap generally in Connecticut runs around 40 to 45%. Now that's a little misleading because people hear that and they go, that means 40% of the people don't pay any taxes. No, it means that we don't collect our full liability, whether it be somebody doesn't remit the right amount of sales tax or any sales tax at all, or whether it be a KIT, or personal income tax, or corporate tax. It generally runs around 40 to 45%. But that's standard in the United States of America, by the way. We're not unique.
So Commissioner, can you clarify what that would be in dollars, the 40 to 45%?
It's hard. There was a number of studies done. The last one I saw was several years ago. John Biello, I think it was a little over $1 billion. I mean, it's substantial. But John, you had worked on that study? Do you remember the number that was in there?
Yeah, thanks, Commissioner. Good morning. We had the last study that looked at the tax gap was specific to sales tax. It didn't include income tax or any of the other taxes that the department administers. It was in the range, I believe, at the time of around 200 million. I think was the number. We can go back and look at that. It was done. I believe it was done in 2012 was the year that it was done. So it's a little bit older. The IRS always puts their number in the IRS, one of the first studies the IRS did, which encompassed all of the taxes at the federal level, put the number at around $345 million at the federal level. So obviously Connecticut is a certain percentage of that, as Commissioner alluded to, but we can certainly get the number for you that we did on the sales tax side.
Thank you. And Commissioner and Deputy Commissioner.
I think it was billion. I think that was billion.
Yeah, it sounds like it would be several billion, even at a starting point. So kind of asking to that, and we might have brought this up in a previous hearing, I'm not sure where it could fit, but if it's in your bill or if it's in 443, I think it's worth discussing, some form of analysis of what that tax gap is so that we can ensure that the practices we're taking on are closing that gap. I think that's something all of us as legislators would want to make progress on, and would welcome your support of including that type of analysis in some way, especially because as Senator Fanfara and even Representative Metzger said, there's plenty of ways of going about this, but I think any auditor that I'm aware of at the state level, can bring in $2 million in back taxes. So, we want to make sure that the decisions we're making here, are really bringing in that further back taxes. So whatever, we can discuss to get us there, I think we want to do so. I did just want to follow up with one other question in your feedback, and I'm just going to take a look at it in 443. In 443, there was also mention, I think, of something that I heard previously in another hearing you would be supportive of, which is the ability for your office to do more analysis and forecasting of proposals. Is that accurate, that that's something you would support?
Yeah, and we actually, this committee, as well as the General Assembly, funded that in this biennium. We are in the process of putting that team together and using as a basis the recent tax incident study as a footprint, foundational work. And we're pretty excited about it. It's sort of a geeky thing, but it's going to be good. It's going to be very helpful for you guys to make some strategic decisions.
30 seconds, please summarize.
Thank you. And timing wise of that ability of staff to start doing that type of analysis and forecasting, is that up and running, or when do you anticipate that group's abilities being up and running?
Our goal is to have by late summer the hiring done, the training done, and as well as our first step into our mission. Really, we're gearing up though for the next session, for the next biennium budget. So we hope that this will be a really good tool again for this team here on finance revenue bonding, as well as the General Assembly as well to get the right forecasting that you need to make decisions.
Thank you, Commissioner. Thank you for that, and thank you. And again, just look forward to talking more about what we can do to capture the tax gap. Thanks so much.
Absolutely.
Representative Piscopo.
Thank you, Mr. Chairman. Thank you, my friend Mark, Commissioner, for your testimony. Appreciate it. Good to see you.
Good to see you.
I hope you would permit me just a general question on policy, Commissioner. We have a bunch of bills on our agenda today. I don't know if you've submitted written on any of them, but it's concerning the tax credits. You know our income tax was sold to us as a flat tax. You take your AGI, your adjusted gross income, pay a percentage on it. And since then, and I've been guilty of voting for some of these, we've permitted certain credits on that income tax over the years, farmers, fishermen, firefighters. And last week, we heard a real heart-wrenching tax credit proposal that I plan to vote for. So, they add up, and I'm worried about that kind of policy going forward. We have a bunch of bills on our agenda today, and they're all great ideas. But do you have any direction or comment or direction from our governor on any specific, just overall policy concerning these tax credits?
Well, the answer to your question, I think what you need as policymakers to be able to make strategic decisions about our tax code is forecasting. And I'm not always sure that fiscal notes and generally information that you all receive to make those decisions, having been a member of that body, is always the latest, most accurate, up-to-date information based on what we're seeing. And as mentioned by Representative Farrar, we're going to have a unit that's going to be able to help you do that in a much quicker manner. In fact, the chairs can even ask for tax incidence on any given credit that'll be put forward, which I think is outstanding way for you guys to make strategic decisions. I don't have an opinion on those policy decisions that you all are debating, but I would say to you, it's my job to provide you with the best information I can about what's the impact of this. Is there a long-term impact? And I think having an easy and simple system to use and manipulate as a taxpayer is positive. I do think that if we keep nibbling away with different credits all over the place, it may get so complex that you ended up hiring somebody to do the work anyways. And I don't know if we get to what we want, right? I always say the best tax incidence is no tax. So the fact is that they are all well-intentioned. They're all great people, like you mentioned. As mayor, I used to do tax credits all the time, so I get it. But I want to give you the right information, good or bad, to make the decisions that you feel are best for Connecticut. That's what you guys do.
Thank you very much, Commissioner. Thank you, Mr. Chairman.
Thank you, everybody, and thank you, Commissioner, to you and your team. Look forward to continuing to work with you on this and these two proposals as we move forward this session. So thank you.
Thank you, Representative.
The next testifier is Emmett O'Keefe.
Hi, am I heard?
You are.
Great. Good morning, Chairman Fonfera and Scanlon, ranking members Martin, Cheeseman, and distinguished members of the Finance, Revenue, and Bonding Committee. Thank you for the opportunity to be here today. We've also submitted written comments, so I will be very brief this morning. My name is Emmett O'Keefe, Head of Public Affairs for Booking Holdings, Priceline, and Kayak. I'm here in support of Bill number 5477, an act concerning sales tax remittance for certain marketplace facilitator transactions, which would streamline the sales tax remittance for traditional rental car transactions. As you may know, Booking Holdings, Priceline, and Kayak are leading providers of online travel services based in Connecticut, with Booking Holdings and Priceline headquartered in Norwalk and Kayak in Stamford. Together, our companies help consumers find accommodations, flights, and rental cars and experiences around the world in more than 220 countries and territories, with thousands of employees, many of whom live and work in Connecticut. Booking supports Bill number 5477 to streamline the sales tax collection for the rental of passenger vehicles. Traditionally, rentals are finalized when the customer picks up the car or truck at the airport or the rental company's place of business. This legislation would simply clarify that the sales taxes may be remitted by the rental car company as defined in the bill and as has been the practice for many years. There is no adverse effect on revenue, as the sales taxes will continue to be remitted by the rental car companies as is done today, and we would appreciate your support for this clarification. Thank you very much.
Thank you, Mr. O'Keefe. I think for the purpose of this committee, I'm just going to ask you in the most simplistic terms possible, just to describe what this bill does, because I think there's been some confusion about that. So if you can just try to, I know you just attempted to do that, but if you could just break it down, the Schoolhouse Rock version, that would be helpful to us.
Sure, thank you very much for the question. Basically, this is to address an anomaly that was created by the marketplace facilitator law that you all enacted a bit ago. And as you all know, because the bill came through your committee or was initiated in your committee, the marketplace facilitator law was to ensure that the collection of sales taxes by remote businesses selling from outside the state of Connecticut into the state of Connecticut. And the intent really wasn't, the issue wasn't in-state businesses like rental car companies that are obviously already located in Connecticut, distributing cars and trucks in Connecticut, and that are already remitting sales taxes in Connecticut. And so basically this legislation would simply maintain that longstanding practice to have the sales taxes collected and remitted by the rental car companies instead of a marketplace. And so it's basically a division of responsibility and allowing the status quo to be maintained. The state is getting all the revenue as it always has, and this would just clarify that practice can continue.
Got it. Thank you, Mr. O'Keefe. Seeing no further questions, appreciate your testimony today.
Thank you for having me. Really appreciate it.
The next testifier is Randy Collins.
Good morning, members of the Finance, Revenue, and Bonding Committee. My name is Randy Collins, Advocacy Manager with the Connecticut Conference of Municipalities. I'm here today to speak on two bills. The first one is 5476, concerning partial fee reductions for stormwater authorities and inclusion of HVAC in school building project grant payments. We support the inclusion of the HVAC as an allowable expenditure within the school project grant system. I think especially during COVID, we've seen the importance of quality air within our system, within our schools, and allowing this as a reimbursable expense would work as something that our municipalities strongly support. And we think very much would work to strengthen the proposal by the governor, which would spend up to $90 million of federal COVID relief dollars to supplement those efforts. Also wanted to discuss within 5476 the provision of the partial fee reductions. CCM strongly supported the adoption of allowing municipalities to adopt stormwater authorities to offset the cost of the MS4 stormwater permit. While we are happy to work with the committee and advocates to strengthen the language regarding the fee reductions that are offered, we have concerns with the way that the language is currently drafted, because it looks at would create a proportional reduction of the proportional reduction of the fee based on disconnection standards. Most municipalities, I think there's over 1,800 stormwater authorities across the country, and by and large, the average fee reduction, total fee reduction, is about 50%, because these stormwater reductions, it's not just runoff, but there's also load limits, other best management practices that need to be taken into account. So we would like to work with the committee to see if we can come up with language that meets all the concerned parties. Wanted also just testify against 5478, a property tax exemption for certain veterans. CCM opposes all property tax exemptions. This is our revenue stream. And currently there are 99 mandated property tax exemptions that are on the books. Current statute, it's 1284 F, allows municipalities to increase the property tax exemption for veterans, but this again would take away that ability for municipalities to mandate that option. And it would, while it does provide some municipalities the option to seek reimbursement, it doesn't guarantee that that money will be there. Again, potentially creating an unfunded mandate. And the last thing I'll say, going back to the stormwater one, based on earlier testimony, one of the things, hospitals were not exempted under this bill. There were no exemptions that were granted. Based on the current state lawsuit, previous lawsuit, the settlement with the hospitals, the bill as adopted last year caps what hospitals can be charged at that no more than 15% of the total fee that a municipal stormwater authority could assess can go to hospital properties. Right now, New London's the only option, the only authority that is in operation. And I think their total assessment on hospital-owned properties is about maybe 2%. Actually, the city of New London is the largest payer. Happy to take any questions and work with the committee on these bills. Thank you.
Looks like Representative Cheeseman has a question for you.
Thank you, Chairman Scanlon. You know, Representative Cheeseman always has questions. So good to see you, Randy. So just addressing the Stormwater Authority, and thank you for correcting me about the hospitals, but hospitals do have a more advantageous approach under this, the legislation that was passed last time, or advantageous treatment?
As I said, because of the settlement between the state and the hospitals, part of that settlement was that no fees, no new taxes to be imposed on them or targeted fees. So in that targeted fee said that no more than 15% of any fee that is assessed, citywide fee that would be assessed could be directed on the hospital. So what the bill said is, yes, you can assess a hospital property for stormwater runoff, but that the total percentage of the fee that is assessed to a hospital couldn't exceed 15% of the total fee assessed citywide.
Right. So
and that expires
a more advantageous treatment. So with regard to the testimony from Jennifer Widness, I mean, one of the frustrations seems to be that the municipalities, that there won't be a uniform treatment of an agreed upon set of mitigation strategies. Would municipalities welcome some sort of guidance on, these are the things recommended by DEEP that are acceptable and this is a recommended structure, or municipalities just want to have this a free-for-all, everybody gets to decide for themselves? Because I think that's a concern for the nonprofits, that there won't be a uniform approach to this depending on where a particular nonprofit is located.
I think we'd be, as I said, we'd be happy to sit down. I know we talked to leadership last year regarding fee reduction language, and we said we'd work on that. I just don't think we could have. We ran out of time to strengthen that, and maybe further clarify what that proper language is. And as I said, I think we'd be happy to sit down and come to an understanding. One of the things that we did when we drafted the bill and worked through this, I mean, it was about a 5-year process, I think, to get this legislation into effect, is that really we wanted to provide municipalities kind of a broad stroke of how they do this, because each municipality is going to be different in how they look at this and how they assess it. But once the fee structure is in place, if you establish that stormwater authority, the assessment is uniform on all real property types. I think the only variance that New London has is there might be a slightly higher fee based on the amount of impervious surface, but as I said, the city of New London, they're actually the largest payer into their stormwater authority. They pay about $150,000 a year into their own municipal stormwater authority. And the benefit is that the money that goes there has to be used for MS4, the municipal stormwater reduction, and meeting that federally mandated permit. So it doesn't go into that general fund, but actually is then in turn used for the very things that they're saying. So New London charges themselves a bill, and then that goes into that fund. So we'd be happy to sit down and look, but it's a matter of when you look through the MS4 permit, there's reductions, impervious surface management, best management practices, leaf management, pet waste management. There's a lot of different aspects of that permit. There's 6 actually actionable items within it. So I think you'd have to look and say, okay, how do all of these, and it's not just impervious surface, disconnect? It's even if you took, I know everyone wants to look at New London, they're the only stormwater authority. A college campus theoretically can be actually fairly easily disconnected from the stormwater system because they have limited, entry and exit points from the roads, the municipal system onto the road. But the traffic that it will track on and off of a campus on a daily basis, that will pick up the sand, the debris that then goes into that whole stormwater system. So they are benefiting from that. And, it's an expensive proposition. We have 4 municipalities currently under suit by third party under suit for violation of the permit under the Clean Water Act. So this is something that municipalities are grappling with. When this, the current permit came out, there was no funding that was provided to town. So we are looking at this as a way to offset some of that cost, and it doesn't need it. But if we can provide a little bit more clarity, we'd be happy to sit down and do that.
Yeah, well, I think that would be certainly recommended. And I think from the nonprofit's point of view, to have some clarity on this in terms of not only having municipalities who do implement this charge establish as a priority how you qualify for the tax credit, but also having some sort of uniform set of standards. So, all right, thank you. Thank you, Chairman Scanlon. Thank you, Randy.
Representative Cabros-DeGroat.
Thank you, Mr. Chairman, and thank you, Mr. Collins, for being here today. Do you have a number of how many towns currently offer the veteran optional property tax exemptions?
I do not, but I'll certainly look that up and get back to you on that.
Okay, maybe we can circle back on that. And then the total number or percentage of veterans who actually are currently receiving those credits?
As I said, I'll certainly look it up. One of the things that we've always said, respond quickly, is obviously we don't oppose that. We're very thankful for the service that they've provided, and obviously, continuing on. But every time we sit there and exempt a group out, it just shifts that burden to a different taxpayer. It's not reducing the cost for this, for our towns to operate public safety, education, MS4, different infrastructure. If this is a state priority, couldn't we not, and I know Commissioner Fountain just asked him a question about all the different credits, could we not make this one against the income tax? So that way the whole state carries that burden and it's not imposed on the municipality to pay the bill for a state policy.
So I guess my next question would be, because 50% of this, basically 50% of the towns, the under $150,000 on the equalized grand list would receive reimbursement. Would it be improving it, say for JFS language, in your opinion, to make the half that aren't being reimbursed to just make it an optional credit?
I believe right now that optional credit exists. Part of the concern was that you are towns with 150,000 equalized net grand list or less, they can apply for reimbursement. Our concern is when we look through the historically, there's any number of programs that have been, pilot exempt properties that we're going to be reimbursed for, and that reimbursement's not there. So we create a program. All right, we'll do this with the promise of reimbursement, or it's exempted with the promise of reimbursement, and then a few years down the road, that money isn't there, and then again, it just squeezes the burden onto, as I said, it's our commercial payers, our residential retirees that might not be veterans. So it makes us nervous to enact a credit or a reimbursement scheme structure without a guarantee that money. And I believe in the language, it says that they may request reimbursement through OPM, but I don't know if the funding will be there to
no, and I completely understand that, and I think that in terms of shifting the burden to other taxpayers, for instance, in Avon, which is a town I represent, the amount comes to about, I believe it's $60,000 that would then be spread around thousands of taxpayers. So I think that when you consider that it's like half of 1% of the United States actually signs up to serve our country, and that's a significant burden. I think that's, I guess to a lot of our minds from what we've heard today is, and I'm sure probably not, probably yours as well, that it's a burden that we all sort of have to bear on behalf. And I did notice the poster behind you. Are you by chance a veteran yourself?
I am. I served in the Marine Corps and did a couple tours overseas. So again, it's one of those, so it makes it interesting. I think my wife gets mad at me like, hey, take advantage of these things. But, but we have to look at, as I said, it's, any one of these individual mandates is not necessarily, it's not going to be the straw that breaks the back, but there are 99 mandated exemptions. I know there's a number of, maybe 100 or more optional exemptions that are provided. And then I think we have over 1,000 unfunded mandates on towns and cities. So individually, none of them are, some of them are backbreaking, but individually, a lot of them are, it's just, 60,000 here, 70,000 there. But when you add up collectively, you go through the statutes and see what's asked of municipalities, it does begin to become an unbearable burden that, it drives up the cost of home ownership, it drives up the cost of doing business, and it's not providing. One of the things, we've looked at it, and I know I've talked with Chairman Scanlon, is, are there opportunities for comprehensive property tax reform that would provide a relief for all of our residents to get away from that regressive tax? And there's a number of different things of revenue diversification, increased regionalism, better abilities for municipalities to cut expenditures. So that, to us, that is the better way to go, is how do we fix the system for everybody rather than, okay, we're going to pick veterans today, and then tomorrow it's firefighters or police or teachers. But how do we grow the pie for everybody?
We're at 5 minutes.
Okay, thank you. I don't disagree with you on the property tax reform, and I thank you for your service. My husband was Navy corpsman attached to the Marines, so I thank you so much for that service and for being here today.
Thank you. Thank your husband for his service. I love my dogs.
Randy, be in touch about the language on the stormwaters, and let's try to see if we can work on this together, okay?
Certainly will. Thank you.
The next testifier is Jennifer Pulse.
Good morning, everybody, and thank you for having me. My name is Jennifer Pulse. I am with Mental Health Connecticut, or MHC, and I'm speaking with comments about Health Bill 5476, and I'm not about to attempt that title. I've tried it 4 times and can't do it, but about the stormwater fee. Mental Health Connecticut is a 114-year-old nonprofit. We partner with individuals, families, and communities to create environments that support long-term health and wellness. We support about 1,000 people per day through our advocacy, community education, and services that include housing supports and wraparound services in Stamford, Bridgeport, Danbury, Waterbury, Torrington, and West Hartford. The proposed credit, as it's written, is better than the original legislation, but it still could represent a significant new cost to our organization and other nonprofits. Since the passage of the original bill, inflation has spiked and the need to pay new taxes on our properties is unfathomable. Levying a new tax on tax-exempt properties would erode the social compact between community nonprofits and the government. Nonprofits have long been exempted from state, federal, and local taxes for a good reason. We provide services so that the government doesn't have to. We're not there to address, if we are not there to address community needs, the responsibility would fall to the government at a substantially higher cost, and those government services would be exempt from stormwater fees. Like many nonprofits, we have contracts with the state to provide essential services, but state contracts don't automatically adjust to increase for costs. And further, as nonprofits, we can't raise taxes or increase our prices in the face of these increasing costs, meaning we're forced to cut services, lay off employees, or close programs in order to manage these increased costs without any increased funding. This proposal could also have a significant impact on organizations like that that own and operate programs in multiple towns. Multiple fees from multiple towns billed to one organization would quickly add up and likely require us to make serious program cuts just to pay the fees. Additionally, each municipality has been empowered to develop its own unique stormwater management program, which could result in different fee structures in each town. Simply put, community nonprofits can't afford to make additional payments to local governments. Please protect the nonprofit services by amending the proposal to exempt property owned by nonprofits from the fee. Thank you for your consideration of our concerns with these new stormwater fees and our request to add language exempting nonprofits from them to HB 5476. Thank you all.
Thank you, Ms. Pulse. Seeing no hands. Bree?
The next testifier is Stuart Savicle.
Good morning, Senator Fonfara, Representative Scanlon, Senator Martin, Representative Cheeseman, and the distinguished members of the Finance, Revenue, and Bonding Committee. My name is Stuart Savicle, and I am Chief of Staff for AFT Connecticut, a diverse state federation of more than 30,000 public and private sector employees, which includes state workers, healthcare workers, public school teachers, paraeducators, and school support staff, as well as higher education faculty and staff. AFT Connecticut is also a proud member of Recovery for All, a statewide coalition of faith, community, and labor organizations united to eliminate systemic inequalities and rebuild a better Connecticut. AFT Connecticut supports Senate Bill 443. It's March Madness season, and while underdogs can be lovable on the basketball court, unless they're from New Mexico, our economy would be significantly improved and would be significantly more fair if the disparity between underdogs and high seeds were a little less extreme in Connecticut. Extreme income inequality and a lack of fairness in our state's tax system represent significant obstacles for Connecticut residents to achieve any measure of shared prosperity. If we can accept that our state has room to improve in these areas, the next logical question should be, how much improvement do we need? Well, to answer that question, we will need access to information that has historically been provided by the Department of Revenue Services. The 2014 state tax incidence analysis performed by DRS, as well as the recently released 2022 report, have been highlighted in a lot of testimony this session. AFT Connecticut has referenced them in testimony on at least 3 occasions before this very committee. Unfortunately, because the 2 analyses did not consider the impacts of the same taxes, we are not positioned to easily compare apples to apples. This committee has considered and will consider many ideas in the form of legislation for how to create a fair system of taxation and an economy that works for everyone in our state. Such ideas generally foster spirited debate with philosophical differences among those who engage in. SB 443 will not, on its own, create a fairer tax system or a fairer economy. Rather, SB 443 seeks to ensure that going forward, legislators will have easy access to the facts and figures that will allow them to make decisions on these economic issues that have proven to be controversial. Perhaps that controversy will dissipate when legislators are armed with relevant evidence that paints a detailed and accurate picture of Connecticut's economic landscape. Thank you very much for your time and for your consideration of my testimony.
Thank you, sir. I see no hands. Bree.
Hi, Senator. The next testifier is Betty Marafino.
Is Betty with us?
Betty is with us. I think she is unmuting and turning her camera on.
That would be helpful.
Yes.
Thank you.
We hear you, Betty.
There you are.
Good morning, Senator Fonfara, Representative Scanlon, and members of the Finance, Revenue, and Bonding Committee. I am a resident of West Hartford, and I am president of the Connecticut Alliance for Retired Americans, which is affiliated with the National Alliance and also part of the AFL-CIO. We have about 50,000 members in Connecticut. And today I would like to urge the committee to support the passage of Raise Bill 443. And in particular, to call your attention to lines 17 through 19 of the bill, which talks a bit about senior income. This past Sunday, on one of the local television stations, there was discussion about people leaving the state of Connecticut. And I wanted to talk a little bit about that because many of our seniors say that the main reason that they leave the state of Connecticut is not for warmer climates, though that too is an incentive, but because the taxes are lower and on their fixed income, it is a lot more comfortable and easier to live. And I know a good friend of mine who lived in Norwalk, Connecticut, recently moved to Charlotte, North Carolina. And she told me that she really didn't want to leave because her children and grandchildren are here, but that it is a lot better in terms of taxes and she can live a more comfortable life. And we don't begrudge the millionaires and the billionaires in this state, but we do urge passage of 443 because we think that we need to see more accountability and we really urge tax fairness. And I also want to refer the committee to a course I took last semester at the University of Hartford President's College. And it was a course called The Two Connecticut's. And in that course, discussion about inequities in healthcare, education, and also taxes was raised. And that course is available online. If you go to the University of Hartford President's College website and
30 seconds,
type in Two Connecticut's, you'll get to that. Thank you very much.
Thank you, Madam. Seeing no hands. Bree.
Thank you. We appreciate your time, Mrs. Marafino. The next testifier is Jim Paris.
Unmuting. Hold on 1 second. You guys caught me by surprise. I thought there were a few more people in front of me. Good morning, Chairman Scanlon, Senator Fonfara, ranking members, Cheeseman, Senator Martin, and distinguished members of the Finance and Revenue and Bonding Committee. My name is Jim Paris, and I am the CEO of the Home Builders and Remodelers Association of Connecticut. I'm here today to ask the Finance Committee to consider amending DRS Agency Bill, House Bill 5473. You have my testimony and suggested amendment language, so I'll be brief. Section 20 of House Bill 5473 seeks to amend the tax credit that corresponds with the conveyance tax found in Section 12-494 of the General Statutes. The HBR is asking that this section of the bill be further amended to exclude the sale of new construction from the increased
We lose Dan?
We did lose Jim temporarily.
Or Jim, I'm sorry.
That's okay. We're going to get him back in the room.
He's coming back now, Bree.
Thank you, Christine. I appreciate that. And Jim is back. Thank you, Jim.
Yes, sorry about that.
Must have been something you said, Jim.
Must have been. Hopefully I'll say it nicely. So I'm not sure where we left off, but I'll continue on by saying that the HBRA is asking for House Bill 5473 to be amended. HBRA is asking that this section of the bill be further amended to exclude the sale of new construction from increased convenience tax derived from Public Act 19-117. You may recall that Public Act 19-117 increased the convenience tax from 1.25% to 2.25% of the portion of the sale that exceeds 2.5 million. The Public Act then provided a tax credit to individuals who remained in the state for 3 years after the sale of the home. When Public Act 19-117 was passed, the intent of the language was as expressed by the legislative leaders was to act as a deterrent to discourage wealthier residents from contributing to the pattern of outward migration by selling their homes and taking the wealth they created in Connecticut to another state. Unfortunately, those small businesses that build homes in this price range but do not pose the flight risk referenced earlier were caught up in the broadly written language. And to make matters worse, those same builders did not qualify for the corresponding tax credit. We're simply asking that the statute's language be tightened up to reflect the original intent of Public Act 19-117 by exempting new construction from the increased conveyance. In 2020, sales of new construction over 2.5 million equal just under 220 million, which means that small businesses would have been able to keep and invest 2.2 million. It should be noted that the small businesses that typically build the custom homes in this price point only build a handful of these homes in a given year. The exemption from the higher conveyance of these small businesses is particularly important in this day and age when they're feeling the pinch in other places like rising land costs, supply chain disruptions, and skyrocketing building materials and workforce shortages, just to name a few.
30 seconds, please summarize.
Sure. Well, no, I'm done. So thank you for your time and consideration, and I'm happy to answer any questions.
Okay. Representative Cheeseman.
Thank you, Chairman Fanfara. Thank you for coming today, Jim. So basically, you want to be exempted from this increased tax because you're not selling them and then moving out of state, correct?
That is correct. I'd rather not refer to it as an exemption, as a statutory correction per se. but yes, in theory, we're looking for that exemption.
So theoretically, you were caught up in something that was intended to incentivize people to remain in Connecticut after they sold their homes. And because you build and you don't have the opportunity to prove you're staying here, you obviously are, you were inadvertently caught up in this net.
That's absolutely right, Representative. I would certainly argue that our small businesses that have been fixtures in the state of Connecticut pose no flight risk.
All right, thank you. Thank you very much. Thank you, Chairman Fanfara.
Thank you, Representative Cheeseman. Seeing no other hands, Bree.
The next testifier who has just joined us is John Catalin.
Thank you, Bree. Senator Fanfara, Representative Scanlon, Senator Martin, and Representative Cheeseman, and members of the Finance, Revenue, and Bonding Committee. My name is John Catalin. I'm with the Connecticut Alliance of YMCAs. Thank you for the opportunity to testify on House Bill 5476. The Connecticut Alliance of YMCAs would like to see that bill include a nonprofit exemption from any new municipal fees or taxes that could be leveled against our organization by the local stormwater authorities. Levying a stormwater fee on YMCAs would divert money away from programs that help people in need at a time when we can least afford it. During the past 2 years, YMCAs across the state of Connecticut have incurred financial losses of $25 million. Our Ys still have not fully recovered financially from the past 2 years, and our membership levels continue to remain stagnant. Our 5 residential camps, which would be impacted significantly by these new fees, still have not recovered financially from their mandated closing in the summer of 2020. Nonprofits have long been exempted from state, federal, and local taxes for very good reasons. We provide services that government does not. If we are not there to address community needs, that responsibility would fall to government at a substantially higher cost. Those government services would be exempt from these stormwater fees. Simply put, additional payments to local governments would be a financial burden on our Ys. During the past 2 years, our Ys have conducted mask, diaper, blood, and food drives. In addition, we had 21 emergency childcare centers open during the onset of the pandemic. The Y never stopped servicing our communities, and we simply cannot afford to make additional payments to local government if we are to continue to provide our communities vital services. Thank you for your consideration of our concerns.
Thank you, John. Seeing Representative Cheeseman under the wire again. I just got to look to the right on my screen so I don't see your hand. That's what I need to. I would never do that. You know that, Representative Cheeseman. You have the floor, madam.
Thank you, Chairman Fanfara. Thank you, John. And I realized the financial burden and the toll the pandemic took on you. But as we look at this increased fees, and this is slightly off topic, I'd just like you to address the increased wages you're having to pay, because I was talking to someone who's in touch with the local YMCA, and they're seeing, again, obviously necessary, but having huge wage increases for existing staff. So that's another cost you're having to afford, and particularly where you don't necessarily want to have to increase your charges to the people you're serving in a huge way.
No, that's correct. I think like every other entity in the state, we're dealing with significant cost increases from a number of issues, but obviously wages is one of those. I can tell you that before the pandemic, the Ys employed over 7,500 people in the state of Connecticut, and we're down to 6,000 right now. And a lot of that has to do with, we understand there's staff shortages all over the state as well. But obviously people are seeking higher wages right now. We simply can't afford to pay them, what they're looking for. And I know all of you are aware of the significant staff shortages we're facing in the childcare industry. So.
All right, thank you. Thank you very much, John.
Thank you, Representative.
Thank you, Chairman.
Thank you, Representative Cheeseman. Representative Mashinsky.
Hey, John.
Hi, Representative.
I'm a supporter of the Y in my town, have helped them with fundraising and so on. They're good folks. But for you and the other nonprofits, there are ways to reduce stormwater fees if you work with some local conservationists to do a rain garden, or to reduce your parking space, or to change some of your parking space into crushed stone so the water can filter down. So it's not a fixed fee. The fee is designed to encourage best practices. And as you do the best practices, the fee drops down because the water is now cleaned by the landscape. So it's not that you'll have that fee forever. And I know I myself have worked with other nonprofits where we put in rain gardens, and it collected the runoff and processed it from the parking areas. And then the water leaving the site is cleaner. And so your financial burden goes down. So be willing, be open-minded and willing to work with some local conservationists to improve your stormwater management, and then you should see a reduction.
Thank you for that comment, Representative. And obviously we will, do everything within our ability to work with organizations to, help with these runoff issues, but our concern is, we face this in other municipalities where they've just decided to send our Ys tax bills, and we're clearly a nonprofit organization. And so, I have to say in some municipalities, we're a little concerned that we're not going to be provided with a process, to adequately, deal with stormwater authorities and prove to them that we're doing our diligence. But I appreciate your comments, and I obviously will make our WISE aware of working with our local environmental organizations to make sure we reduce our runoff and deal with this issue.
Okay, one of the groups that can help you is the soil conservation districts, and Yukon has some folks. Some of the watershed groups have people that will help you. But we had this discussion in the environment committee, but the farmers wanted to be exempt from stormwater requirements because they're farmers, and the water pollution effect doesn't care if it comes from a commercial property or a nonprofit property or a farm. It's still water pollution. So, the incentive is that everyone should be working to reduce the runoff from their property because it helps everybody downstream, including the reservoirs and places we're trying to protect. So I just want to encourage you to reach out to them because they're looking for places to do projects, and you might be one of them. So
okay,
help reduce your stormwater load.
Well, thank you, Representative Mashinsky, and obviously we always thank you for your support of the YMCA in Wallingford. We know you've been a supporter of that Y for many years, and we appreciate that.
Okay, thank you, John. Thank you, Mr. Chairman.
Thank you, Representative Mashinsky. Representative Zupkis.
Thank you, Mr. Chair, and I apologize. My camera is not working. So apologies to you and to John. Hi, John.
Hi, Representative.
As you know, I love the Waterbury Y. My husband's been the board chair. He's still on the board. I've been there 35 years. He's been there 50 something years. And we absolutely love it. And I completely understand they are always looking for ways to help make their Y better, whether it's with water or whatever it is. And always talking to the Y, because I go there often, it's always another burden on the Y in some way, shape, or form. And so I know we want clean water and we want all these things, but I really hope that we will all look at ways to help the Y instead of putting restrictions and onerous regulations and all these things on our Ys. Again, we want clean water. We want all these things. And I think I can speak for Waterbury. I think they do a fabulous job with all of these things. It's just that I think the legislature needs to ease regulations and burdens on them to help them because they're struggling and they do such a great job. Again, I can only speak for Waterbury, but what they do in the city of Waterbury to the underserved, the Black and brown community, if they ever had to close, it would be devastating. And they've been there. So I've seen the troubles that they go through and continue to go through. So I just wanted to say that.
Well, thank you for your support, Representative. And I know your family's been involved with the Waterbury Y for a number of years. I've actually seen you at the golf tournament a few times, so we appreciate your support.
One second, Dan. Yeah. 1 second. Thank you very much, Representative Zupkis. Seeing no other hands. Bree.
Thank you, Senator.
Thank you, John. The next testifier is Reverend Josh Pollock.
Good morning, Senator Fonfara, Representative Scanlon, and all the distinguished members of the Finance, Revenue, and Bonding Committee. My name is Josh Pollock. I live in Glastonbury. I am the minister of the Unitarian Universalist Society East in Manchester. I'm also a clergy leader with Recovery for All, a statewide coalition of faith, community, and labor organizations united to eliminate systemic inequalities and build a better, more fair, more just Connecticut. Thank you for the opportunity to testify in support of SB 443 concerning future tax incidence reports. I support a consistent, transparent, data-rich system for tax incidence reporting in Connecticut. This is because our state's regressive tax system is one of the principal drivers of economic inequality. SB 443 would ensure that our tax incidence reporting provides the legislature, and this committee in particular, and the governor with the breadth and depth of tax data you need to design tax policy that effectively addresses economic inequality. Connecticut's first tax incidence analysis from 2014 found that our state and local tax system disproportionately impacts low and middle income earners. I know you've talked about that in this committee. Specifically, it found that taxpayers earning up to $48,000 per year effectively spent 23.6% of their income on taxes. The middle class paid about 13% of their income in taxes, but the top 10% of earners paid just 10%, and the top 1% paid an astonishingly low 7.5%. Last month's tax incidence report reveals what many of us already knew through experience, that low and middle income taxpayers have lost ground since 2014, now paying up to 26% of their income in taxes, while the wealthy's effective tax rate went up just 0.3%. The same upside down effect is also clear with regard to corporate taxes. What's troubling about the 2022 report isn't just that it shows the rich are getting richer and the poor are getting poorer, but that the DRS team that put it together chose to utilize a completely different methodology to prepare that report than was used in 2014. I mentioned some of the differences in my written testimony, along with Commissioner Boughton's inability to answer this committee's questions about understanding relative tax burdens broken down by gender and race. The bottom line is that we know the disparities are bad, but we don't know their full scope. SB 443 will ensure that future tax incidence reports are detailed and uniform, giving policymakers the tools they need to right-size Connecticut's unequal tax burdens. To take this one step farther, we encourage the committee to add language that mandates future reports include data on racial and gender makeup for each income class. Thank you, and please support SB 443.
Thank you, Reverend. Seeing no hands. Bree.
Thank you.
The next testifiers are Sana Shah and Patrick O'Brien.
Here, Senator Fanfara, Representative Scanlon, Senator Martin, Representative Cheeseman, and esteemed members of the Finance, Revenue, and Bonding Committee. My name is Sana Shah, and with me today is Dr. Patrick O'Brien, and we are testifying on behalf of Connecticut Voices for Children in support of SB 443, an act concerning the tax incidence report, the tax incidence analysis, and the disclosure of returns and return information. This bill will significantly increase tax transparency, an essential component to tax reform, essential for us as residents to understand how our state's tax system impacts us, and essential for lawmakers as you craft and pass legislation. While we support SB 443 as written, we have submitted in-depth testimony supporting the bill. For the purposes of time, in our oral testimony today, we will focus on 3 recommendations to strengthen the bill even further. SB 443 would allow the co-chairs of the Finance, Revenue, and Bonding Committee to request that the DRS provide a tax incidence analysis of any legislation that would impact tax revenue for more than $20 million. Using that same threshold, our first recommendation is to require that DRS include in the tax incidence report any tax that generates more than $20 million in revenue, which would cover the 4 taxes from the 2014 report that were excluded in 2022. It would also cover other taxes not included in the 2014 or 2022 report, such as the relatively new pass-through entity tax. Second, we recommend requiring that DRS to include in future tax incidence reports an estimate of the impact of Connecticut's tax gap on the average effective tax rate by income decile, and an estimate of the overall size of Connecticut's tax gap. The tax gap primarily benefits the wealthy due to limited information reporting and limited auditing. What's more, Connecticut's tax gap is likely greater than that of the US as a whole. This is because Connecticut has a higher share of opaque income sources that accrue disproportionately to higher earners. And like the IRS, the DRS staff has decreased considerably over the last 2 decades. The tax gap is related to tax incidence in 2 key ways. If income is underreported, especially the opaque income sources that accrue disproportionately to higher earners, the real effective average effective tax rate for the wealthy is lower than the reported average effective tax rate in the tax incidence report. Meaning if the tax incidence report excludes an analysis of Connecticut's tax gap, it likely understates the unfairness in Connecticut's tax system. For
30
example,
seconds, please summarize.
the Treasury Department estimates that the misreporting rate for opaque income sources that accrue disproportionately to higher earners is 55%, compared to less than 1% for ordinary wage and salary income. As a result, the Treasury Department estimates that the top 5% of tax filers are responsible for more than 50% of the tax gap, and the top 1% of tax filers are responsible for nearly 30% of the tax gap. Additionally, policymakers could use revenue from closing or reducing Connecticut's estimated $2.6 billion income tax gap to fund several proposed tax reforms that would make Connecticut's tax system fairer for working and middle-class families. Finally, we recommend requiring the DRS to develop the tax incidence report entirely in-house or release a report detailing the additional capacity that is necessary. We commend the committee for elevating this important bill, and thank you for listening. Your continued good work helps us make the state better and fairer for all Connecticut's families. Again, Dr. Patrick O'Brien and I are happy to answer any questions.
Good, because you have at least one coming your way. Representative Farrar.
Thanks, Chairman. Thanks, Sana. Actually, a quick question because it's similar to the question I asked of the commissioner earlier. You did note in your testimony that it's estimated that Connecticut would have about $2.6 billion in unpaid taxes. Can you share where that number comes from? Because I think for so many folks across our state, you know, we can't really fathom that we have that much revenue that we haven't collected. So can you share how you came to that?
Thank you, Representative. It's a great question. Patrick O'Brien for the other representatives here that aren't familiar with me. So in our tax report in January 2022 that we released, we showed that the IRS essentially highlights two causes of the federal tax gap. So it's the income sources, and they talk about how rental income sources, different business income sources have a very high misreporting rate, estimated at about 55% compared to wage income, which is at about 1%. And so we have data from the Bureau of Economic Analysis that shows essentially how the main sources of our income, and we have a higher share of those quote opaque income sources. So based on that, we think that we have a substantial tax gap. And then the other component is essentially limited auditing. And so the IRS focuses at the federal level of the decline of their resources. And we show at the state level that we've had a similar decline in our resources. The DRS staff since 2000 has declined by about 25%. So basically, if you take the higher percentage of opaque income sources that we have and the low level of auditing, we think that it's reasonable to use the percentage level of the tax gap at the federal level and apply it to the state level. So the federal income tax gap is estimated at about 19.4%. And if you simply apply that to our state income tax system, that comes up with about the 2.6 billion number, at least at the time that we were based on the forecast that was available. So as we've tried to mention that we use this as a starting estimate, we think that it's a reasonable estimate to begin with, given that the state hasn't provided another estimate, but the state has largely, I think, agreed that there is a substantial tax gap. I mean, we saw the deputy commissioner say that for each auditor that's hired, you get about $2 million. That's actually relatively low compared to the current budget. So the current budget increased the funding for the DRS by about $1.1 million. That was to hire 5 individuals as well as some software updates, and they're projecting that would bring in $40 million. So that's actually a $35 return for each dollar spent. So based on all of this data, we've come up with an estimate that we think is $2.6 billion, but we really would like the state to provide an official estimate.
Thank you, Patrick. And just to clarify, that's $2.6 billion on an annual basis. That's estimated, correct?
Yes, so that's the current existing annual tax gap, yes.
Thank you. And there's no reason to your research and assumption that we could not move forward and include this in some type of ongoing analysis that DRS does for the state of Connecticut, correct?
Yeah, so we think it's important, again, for two reasons. So one, I think the main attention is it's just a large source of money. And so a lot of the debate over, funding the property tax credit, child tax credit, and so on is how are you going to pay for those? This is a big source of money, but we also think it's important to put it into the tax incidence analysis because it has major implications for tax fairness. So the tax incidence report is based on reported income. And so if you exclude the tax gap from that estimate, it's basically going to underestimate the unfairness of the current tax system. And the main issue with that is, as we said with the IRS data, is essentially about 50% of the tax gap is estimated to come from the top 5% of tax filers. And so you might see before applying tax credits that, the average wealthy family has an effective tax rate of 6.99%. But that's based again on reported income. And if they have a tax gap of about 19%, which mirrors the federal tax gap, then their actual effective tax rate for the state income tax is below 6% before applying those tax credits. So it's a matter both of fairness and funding tax credits that could then make the tax system even fairer.
Thank you, Patrick. And to that point, I hope those are items that my colleagues can agree on. Those are things that we should want as a state, especially around our tax gap analysis that, so many folks, the majority of us, really are paying in, to our communal and contributions as a state. And we want to make sure that those that are not are really held accountable. So thank you for highlighting that. I did have one other quick question about 443. Yes, it was noted by the Commissioner of concerns around including demographic information in the incidence report. Could you just share your perspective on how we could do that in an effective way?
Yeah, so I believe that they emphasized that they would have to change the tax forms. That may be the case for some of that information. And if that is the case, I think that, we would support doing that. I would raise the issue of, I know that the property tax currently is limited to seniors or those with a dependent. So presumably the state does have some of this information. And I would assume that they would know then who has dependents and or who are seniors. So some of this information, presumably the state already has. For other information, if they had to change the form, I think we would support basically whatever steps that they need to take to get that information, which would be very helpful.
Thank you, Patrick. Appreciate that. We'll look deeper into that with your input and hopefully DRS. Thank you, Chairman, for the time.
Thank you, Representative Farrar. Seeing no other hands, Bree.
The next testifier is Margaret Henderson.
Hi, my name is Margaret Henderson. I live in Danbury, and I'm co-president of the Board of Trustees of the Unitarian Universalist Congregation of Danbury. I'm also a member of Recovery for All, a statewide coalition working to eliminate systemic inequalities, many of which were highlighted by the pandemic, and to rebuild a better Connecticut. Thank you for this opportunity to testify in support of SB 443 and an act concerning the tax incidence report. Trying not to repeat too much of what's been said, Connecticut's first tax analysis from 2014 found that our state tax system is regressive. Specifically, those earning less than about $50,000 a year paid almost $1 out of every $4 they earn in taxes. For the top 1% of earners, out of that same $4, they paid about 30 cents. And that's before tax gap, as has been mentioned. This also does not take into account, because it was 2019 data, the 1% sales tax surcharge on all restaurant meals and prepared foods that went into effect then. This is disproportionately affecting lower income people, because if you're struggling to make ends meet, you're short on time to cook meals. What's particularly troubling for us is that the 2022 report excluded 4 categories of taxes that are actually regressive: taxes on utilities, insurance, and real estate transactions. These are paid by citizens indirectly because businesses shift them onto households. Lawmakers need historical data for forecasting and to inform their tax policy decisions. SB 443 would ensure that future reports include data that can be compared year over year so that you can identify trends over time. To ensure that future reports provide a full picture of how tax burdens impact all kinds of taxpayers, including taxpayers of color and women, I encourage the committee to include the following language after line 21 for each income class, the racial and gender makeup, end quote.
30 seconds, please summarize.
2 years ago, our congregation had some people from the United Way come talk to us about the ALICE report on asset-limited low-income or asset-limited income-constrained employed individuals. About 38% of Connecticut households fall into the category of ALICE. And for households of color, it's about 60%. These are a lot of people struggling to pay their taxes, and we need more equitable tax structure, and we need a transparent reporting system that tracks the same stuff year over year. Thank you very much.
Sorry, I'm swallowing a bite of my sandwich. Thank you for your testimony today, Margaret. Appreciate you being here. I don't see any questions, but thank you for coming.
The next testifier is Dr. Alan Selinsky.
Hello, let me get my camera in place here. Does that look pretty good? Good. Anyway, my name is Dr. Alan Selinsky. I'm a board certified ophthalmologist in West Hartford, Connecticut. Been practicing in Connecticut for over 30 years. I'm a member of the Connecticut State Eye Physicians, and I'm here to represent the testimony of 800 physicians from the Ear, Nose, and Throat Society, the Urology Society, the Ophthalmology Society, and the Dermatology Society. Thanks for giving me an opportunity to express our support of Bill 441, which is the credit for ambulatory surgical centers. I'd also really encourage you to eliminate the tax altogether. And I'm going to give you a couple boots on the ground reasons why. 2 reasons I'll go over in the next couple minutes. One is ASCs are by far the best places for patients to go and for doctors to practice. They're very cost effective and they have very high success rates and very, very high patient satisfactions. I'm a chairman of one of them, and we do these wonderful surveys each year of our patients, and we have these outcomes booklets which show that ASCs are the place to do the surgery. However, ASCs are very, very, the profit margins become very, very low since COVID. It's very hard to recruit staff, and the ones we recruit, we have to pay more. And furthermore, we, as other industries, we are having supply chain issues, and we have to pay a lot more for supplies than we did before COVID. And we're hiring travel nurses at 3 times the price of a regular nurse. So profit margins are down over the last few years, and we could ill afford to continue with this tax on our gross receipts. Furthermore, the recruitment of physicians. I now fortunately have several ophthalmologists in my company. However, for the first 15 years, it was almost impossible to recruit ophthalmologists to Connecticut. They like to be in Boston, they like to be in New York if they want to be in a big city, or they want to be elsewhere where the cost of living is very, very reasonable. And that's really not Connecticut at this point in time. One of their biggest questions when they come to see us is, will I be able to have ownership and a say in the control of an ASC? And with the CON rules being very difficult to get centers, it's hard to find spots for them. And with the tax on gross receipts, it's driving some of them away as well because the price is just so high. So it's wonderful that we have ASCs available, but we have to make them more amenable to physicians that are in the state and also to help recruit physicians from out of the state. That's about all I have to say. So I encourage you to support the bill and go further if you could to eliminate the tax altogether. Thank you.
Dr. Lindsay, thank you for taking time out of your day to be with us to testify. And I don't see any questions, but appreciate you being with us.
Okay, thank you. Bye.
The next testifier is Paul Hoare.
Good morning. Can you hear me okay? Great. Good morning, Senator Fonfaro, Representative Scanlon, and members of the Finance and Revenue Bonding Committee. My name is Paul Hoare, and I want to speak in favor of House Bill 5476. I've been in the air quality business since 2006. It's in focusing on air pollution caused by fossil fuels and promoting cleaner air through combustion of plant-based fuels. Within the last few years, I've gotten involved in indoor air quality for folks, family members who have had problems, and I represent air purification technology and ARIS. Clean air is important to sustaining human life. As we know, during our lifetime, we breathe approximately 20,000 times a day, and indoor air is extremely important since we often spend 90% of our time indoors. Now, the standard we should emulate indoors is present outside of the LOB. In Hartford, the index today is actually 21, which is of good quality, and that's the standard that we should be aiming for indoors as well. This measurement is maintained daily by the NOAA and EPA. Now, indoor air quality matters because the EPA has discovered that indoor air can be 200 to 500% more contaminated than outdoor air. So besides temperature and humidity, indoor air quality is defined by the number of particles, including airborne bacteria, mold spores, viruses, formaldehyde, and volatile organic compounds, basically allergens and particulates, infectious agents, and toxic compounds. These particles range in large size from 10 microns to small size, such as 200 nanometers, which is the size of the SARS-CoV-2. I believe these specific measurements of particles should be defined in the air quality program outlined in Section 2 of HB 5476. Now, the sun and nature provide us this level of cleanliness. Nature uses UV radiation from the sun to break down oxygen and water molecules in the air to oxidize harmful chemicals and pathogens. Otherwise, outdoor air would be unbreathable. Now, the current solutions to maintaining indoor air quality is to provide ventilation systems that control temperature, humidity, and airflow. I would
30
argue,
seconds, please summarize.
Thank you. I would argue in favor of enhancing the ventilation systems in schools with the new photocatalysis technology to deactivate the unhealthy pathogens that older technology passive filters aren't able to capture. Thank you. Mr. Hoare, thank you so much for being with us today and for testifying. I don't see any questions though.
The next testifier is Vincent Aspromonte.
Thank you. I appreciate the opportunity to speak to the chairman and the rest of the committee members. My name is Vincent Aspromonte. I am also speaking in reference to bill number 5476, and I'm in favor of that. However, I do have a concern. The amount of money that is proposed to be earmarked for upgrades to school ventilation systems, that it should include language that upgrades mean the addition of technologies, not just the increase in density in filters. As the gentleman before me, Paul Hoare, just stated, the EPA breaks our indoor air quality into 3 different categories. They are particles, allergens and dust and particles, infectious agents, and then also toxic compounds. Simply using or upgrading our current HVAC system's ventilation rate or filtration has proven to be ineffective in stopping the likes of the SARS-CoV-2 virus. Case can be made by looking at Marin County, California, where they had all these measures in place, and yet a teacher still infected a majority of the class. They had windows open on both the right and left side of the room, HEPA filters at the front, masks on all the children, and the teacher removed her mask to read a story and infected approximately 80% of that class. Technologies today are so much more advanced than the 1940s capture and retain process of using denser filters or increasing ventilation rates, which go against ESG metrics and would only put burden on the financial responsibilities of schools to try and maintain these denser filters. I can point to Nashua, New Hampshire School District, which tried this. They went from the standard MERV 8 filter in their ventilation system to MERV 13. Their quarterly budget went from $8,000 a quarter for filter maintenance and replacement to almost $50,000. This would be unsustainable. So my concern is this $90 million that's being talked about that the governor wants to allow to be appropriated for grants, that people need to be educated, both in the education world as well as in the legislatures, that technologies do exist today that can actually inactivate potential hazards that are the common cold, seasonal flu, the pandemic we're all experiencing now, and whatever future pandemics may come down the pike. The inclusion of language that technologies be part of the upgrade is what I'm asking the committee to consider putting into the bill. And if you have any questions,
30 seconds, please summarize.
Sure, I'm just about done. Thank you, Bree. If anyone has any questions, I'm happy to answer them.
Thank you for being with us today. I don't see any questions, but appreciate your testimony.
Thank you.
The next testifier is Ed Hawthorne.
Good afternoon, Senator Fanfara, Representative Scanlon, and members of the Finance, Revenue, and Bonding Committee. My name is Ed Hawthorne. I'm proud to represent over 200,000 working men and women as president of the Connecticut AFL-CIO. I'm also here to testify on behalf of the Recovery for All Coalition. Thank you for the opportunity to testify in support of SB 443, an act concerning the tax incidence report. Tax incidence report, you've all heard about this today, but I want to emphasize it's an estimate of the total tax burden placed on residents. It includes both the tax filers, excuse me, paid directly and those that are indirectly shifted on them by businesses through higher rents, consumer prices, and fees. When Department of Revenue Services Commissioner Mark Boughton appeared before this committee on March 11th, he cautioned at comparing the two analyses, the one done in 2014 and the one done this year, since he used a different methodology to prepare the 2022 report. Overall, the data in the 2022 report is reported by individual rather than by household in 2014. So we can't get an apples to apples analysis. It's almost apples to oranges. There were high hopes that, the two reports we'd be able to look at and see how, basically the analysis of the taxes and how they, impact the population of the state of Connecticut. Senate Bill 443 will ensure that future tax incidence reports are done in a detailed and uniform way by giving policy members the tools they need to right size Connecticut's unequal tax burdens by requiring inclusion data in the language set forth in my written testimony, and also the additional language that we're proposing set forth after line 21, that is for each income class, the racial and gender makeup. It aids in making informed policy decisions concerning revenue. It also fosters transparency as well. The scale of Connecticut's inequality demands a bold response. If enacted, SB 443 will help lawmakers be effective in their efforts to stop the financial hurt so many families are feeling and set Connecticut on a path of robust economic recovery by creating a fair tax code. Thank you for the opportunity. Thank you for your time, and I'd be happy to answer any questions you may have.
Mr. Hawthorne, good to see you. Thank you for being here. Thank you for your testimony. We've had quite a few people today testifying in favor of this, and this is an important topic for the committee, but thank you for being here. I don't see any questions.
Thank you. Have a great day.
The next testifier is Robin Kaplan-Cho.
Thank you. Hi, good morning, everyone. Senator Fonfara, Representative Scanlon, members of the Finance Committee. My name is Robin Kaplan-Cho, and I'm the retirement specialist for the Connecticut Education Association. And we represent active and retired teachers across the state who are members of the state teachers retirement system. I'm here to express CEA support for Senate Bill 442, and we thank the committee for raising the bill. We respectfully request, however, that the bill be amended so that all retired teachers and spouses who are on their school district insurance plans, because they are not yet eligible for Medicare, receive a doubling of the subsidy. It's currently $110 a month per person. That amount has not increased since 1996. And as you can imagine, the cost of health insurance since 1996 has just skyrocketed. Senator Martin had asked an earlier speaker about what the cost of these plans are. And I just wanted we have all of those rates, but I wanted to just share, and I have it in my written testimony as well, some of those current premiums. So just a random sampling. Currently for an individual retiree, one person in East Hartford, the monthly cost is $1,034.48. For a retiree in Westport, the monthly cost is $934. For a retiree in Voluntown, the cost is $873 per month. And that's after that small subsidy is applied. For a retired teacher and spouse on the plan, so for two people, the current cost for an East Hartford couple is $2,068 a month. For a retired couple in Simsbury, it would be $1,748 a month after the subsidy is applied. So as you can imagine, while the subsidy is something, it certainly is really eating into a significant portion of that retiree's pension. And it makes it impossible in many cases for that retiree under 65 to even retire at all. I would also like to point out the bill specifically covers those retired teachers who are over 65 and are not eligible for Medicare because they were hired. It's generally because they were hired before 1986. They currently receive a double subsidy. And that your current bill language would increase that from $220 to $350. We're asking that they also receive a doubling of their subsidy. So both the under 65 retirees who are waiting to go on Medicare and the over 65 retirees who will not be able to ever go on Medicare, we're asking that the bill be amended to provide a doubling in all cases.
30 seconds, please summarize.
Yes, so again, I think it's fair to say that since the statutory subsidy at 110 has not increased since 1996, it's obviously been too long. The time is now to increase that statutory amount. Again, it may still be that these healthcare costs are prohibitively expensive, but clearly it would be at least a step in the right direction. Thank you very much.
Thank you, Ms. Kaplan-Cho, for your testimony. I'm just reading your written testimony, and obviously the exorbitant cost of healthcare is quite obvious in looking at that geographically. You said 1,000 retirees do not qualify for Medicare. Is that the total across the state of all the retired teachers? 1,000? That's the number?
Yeah, according to the retirement board, about 1,000 retirees are in that small group of retirees who did not contribute to Medicare. Since 1986, all teachers are paying into the Medicare system. So that's obviously a decreasing subset of retirees, but currently there are about 1,000 of them who are over 65 and have paid these rates since they retired. Some of them may be into their 90s.
Okay.
And remember, many of them retired at a time where their salaries were significantly less than a retiring teacher may be receiving now. So they are certainly in the worst position of all.
Though fair to say that even a teacher retiring now is being compensated much less for that profession than other professions. So
right, I mean, right. If you look at those monthly premiums, they are, as I said, they in many cases can eat up about 25% of their monthly pension.
Yeah. Okay, thank you. Representative Doucette.
Thank you, Mr. Chair, and thank you for your testimony. I wonder if you heard the earlier speaker, Rita. It sounds like you did. I think she's probably one of your members. And she had an interesting proposal to expand this to the traditional Medicare supplement. What's your position on that?
So, okay, shifting gears a bit. So that has nothing to do with this subsidy. This subsidy language, the statute that I'm referencing is solely for those who are under 65. There's a different statute that provides a Medicare plan through the TRB for those who are on Medicare. And just to be clear, so she's asked, every retired teacher and spouse who is on one of the TRB's Medicare add-on plans is receiving the same subsidy. Because the subsidy by statute is equal to 1/3 of the cost of the base plan, which is not the supplemental plan that she was referring to. So as the cost of that base plan goes down, the subsidy amount goes down because 1/3 obviously of a lower premium is a lower amount. So I just want to be clear that the committee understands every retiree and spouse on that plan is getting the same amount of subsidy. It's just that those who are on the traditional Medicare supplement plan, that same amount represents a smaller percentage of the premium that they're paying. It's a buy-up plan. And obviously with a buy-up plan, you're going to be paying more. So while in theory, you know, we would support the notion of increasing everyone's subsidy, you know, we are also having to look at what the impact on the retired health insurance fund would be. Back when the TRB only offered that supplemental plan, the fund was on the verge of bankruptcy, it seemed, every other year. And we continually, CEA continually testified that that fund needs to be preserved. So the TRB was able to offer a less expensive plan, which cost the retiree less, but it also cost the state less. So the proposal that she's referencing would just cost the state more. And I assume most, if not all, retirees would move over to that more expensive plan if it was more affordable for them. So again, in theory, it would be great. I'm just concerned that we would find ourselves back in the position of that fund going potentially insolvent, as it had almost done for decades.
Yeah, understood. And I guess I agree with you that because it sounds from everything that I've heard from retired teachers that it is a better plan to be on.
Well, can I just comment on that? Because the buy-up plan you're referring to, the traditional plan, you know, that's a matter of opinion. I think it's fair to say that those retirees who are on that plan are very happy with it, which is great. But also those 80% plus retired teachers who are not on that plan, they're on the base plan, which is a lot less expensive. The feedback on that has been very positive. And I have to say, you know, my own mom is she passed away, but she's a retired teacher. She was on that plan up until very recently on the base plan, the cheaper plan, and had significant medical issues, significant hospitalizations. And as the person who managed her healthcare and her bills, it was a phenomenal plan. It is a phenomenal plan. So I can say from firsthand experience, you know, there's nothing, it's not an inferior plan. It was excellent.
Okay. Okay. And then one more follow-up. We did hear that there's another bill pending in approps, basically dealing with the same subject matter or maybe slightly different. Can you explain just so we're aware of what's happening there and how this bill is different?
Yeah, so that's Senate Bill 107, and that bill is a little vaguer in terms of the language of that bill. It just references going from 220 to 350, but it doesn't specify which part of the statute it's referring to. So again, we made the same statement, which is we think that all retirees on district plans should get a doubling. So from it says 220 to 350. So I can only assume it maybe like your bill, it's referring just to the retirees over 65 since they're getting, and I know this is highly technical, so I apologize, but I'm just completely guessing that they're both intending to do the same thing. But I want to be clear, that's a very small group of retirees, very much in need of an increase for sure. But it's, as I said, about 1,000 retirees fall into that group. And we're asking that all retired teachers, including those in the district plans, see an increase because none of them has seen an increase since 1996.
30 seconds, please summarize.
Okay, no, that's helpful. And that's something obviously we would have to try to reconcile as we
yeah, and I'd be happy to work with any of you in terms of clarifying the differences or what the current status is. So please feel free to reach out if I can be helpful.
Okay, thank you, Mr. Chair.
Representative Campbell.
Thank you, Mr. Chairman, and thanks for being here today. I had a question because, like Representative said, we talk to retired teachers about this quite a lot, actually. I hear about it so frequently. And I know you said that the plans are pretty comparable, and that's, of course, not what we are hearing. The one plan, I think it's called Medicare Advantage, but is it not even run by Medicare? My understanding it's third party.
Well, both plans are run currently, and just starting as of January 1. It had been through Anthem the last 2 years. Now, starting January 1, they're both provided through United Healthcare. So yes, okay. the base plan is a Medicare Advantage plan. That's the plan I was referring to. Again, I can only speak firsthand to my own personal experience with my mother. She was on the Medicare Advantage plan, both under Anthem. So she had been on it when it was back as a Medicare supplement plan under Sterling. She moved over to the Anthem Medicare Advantage plan. We were a little, cautiously optimistic, but it worked. That was a great plan. And that plan is now offered through United.
Okay. And
both of them.
In terms of the cost of the plans, my understanding is the less expensive one went down even more, but then the other one jumped up significantly. Is there any, do you have any idea why that happened?
Sure, yeah. So the statute provides that the state subsidy is equal to 1/3 of the cost of the base plan. The base plan is the Medicare Advantage plan. As that cost of that plan goes down, 1/3 of that amount also goes down. So the subsidy is decreasing because the premium is decreasing. And I know it seems, how often are we ever talking about health insurance premiums decreasing? But it did. So again, my mom saved money every month when her premium went down. So as that cost went down, the amount applied to the people on the buy-up plan, that subsidy amount went down, but everyone's getting the same amount. For those others, it's being applied to a more expensive plan. So it's not, it's not going to, reduce the cost as much as it will be if you're on the cheaper plan, but it's the same amount for everyone. But 30, whatever that amount is, 30 something dollars a month.
Okay.
But you get more bang for your buck if you're on the less expensive plan in terms of how much of your premium is covered by the subsidy, if that makes sense.
Yes, no, I can understand that. And then just one last question, because it's something else that we hear about a lot from the retired teachers. If there was JFS language that, supported more oversight, around the TRB board, or at least more retired teacher input, is that something that you would support?
Well, we would absolutely support an additional retiree to seat on the retirement board. There are currently 2 and 4 active teacher seats, all of them elected by their own peers. So we absolutely support that addition of a retired teacher to the board.
Okay, and as for the oversight, more oversight, for TRB?
There is a bill pending in appropriations that would put the TRB under the comptroller's office for administrative purposes only. I testified on that on Friday. It's hard to say, whether we support that or not, in the sense that I can't imagine what the efficiencies would be, because unless the comptroller's office has additional staff and resources that they're not currently using, that could be applied to the TRB. I mean, if that were the case, then it might make some sense. But I would imagine they may be short-staffed as well. So if it would improve the service to teachers, both for active and retires, we would certainly be willing to consider that. But I think the TRB testified on Friday, their administrative cost per member is, I think, $20 a month, which is perhaps the lowest in the country. So they're doing a very good job with the limited resources that they have. And they've really worked on improving the services over the last several years. So, I'm not clear why moving them is going to mean better programming or services. So, but if, I'd have to hear more about that.
Yeah, I think some of the concern may have been also around just transparency and getting the answers that folks need when they ask the questions that they want to get the answers to. So I think
we haven't, I know that there's some issues that I've heard from some retirees, but our experience has been that that the retirement board has been very responsive to members. So again, they don't have the phone lines, it could take a while to get through. The board meetings are now on Zoom. Anyone can comment and submit any kind of, oral comment at the end of the meeting. So yeah, that has not been my experience.
Okay, thank you for your time.
Thank you.
Senator Martin.
Thank you, Mr. Chair. Hi, Robin. Thank you for testifying. So, Robin, I just want to be clear. It sounds like we're talking about minimum two different groups and maybe a third, and that's what I want to clarify. So we have a group of retirees that prior to 1986 that never contributed to the Medicare program. This pool of retired teachers are about 1,000. Is that correct?
Correct. That's what the retirement board has said. Yes.
Okay. And how much do they receive in subsidies?
So if there's a single, and most of them are single. So if there's a single retired teacher over 65 who's on their district plan because they didn't qualify for Medicare, they're paying, my written testimony, every district has a different premium cost. So I have the full list of all of our local associations, but it's ranging anywhere from well over $1,000 a month, the cost, to $800. They receive a double subsidy of $220 a month once they hit 65. So let's take a single retired teacher, retired at age 62, so was not 65 yet. So that retired teacher received $110 subsidy from age 62 to 65. When she turned 65, because she couldn't move over to Medicare, which is what most retirees do, she was then able to apply for a double subsidy. So the 110 goes up to 220, since she's going to be on that district expensive plan for the rest of her life, from 65 to however long, into her 80s or 90s. So the legislature did adopt what they call a double subsidy.
Understood. So if you're under 65, you receive 110. If you hit 65, it's 220.
Right. If you're on it, the only reason you would be on a district insurance plan as a retired teacher if you're over 65 is because you don't qualify for Medicare. I know it would make no retirees can afford to stay on that plan and basically decline Medicare just to stay on the district plan. It's prohibitively, they can't wait to turn 65 so that they can at least move over to Medicare, get the TRB plan, and have a much more affordable monthly premium.
Got it. Okay. I think that clarified it for me there. I was confused regarding the 110 and the 220.
Right. And yes, and I just want to be clear that as I read the proposed bill 442, as I read the bill, that only addresses those in the over 65 district insurance, that 1,000 or so retired teachers. The bill does not address all of the rest of the retirees.
And how many others would qualify in the other category?
You know what, I'd have to get back to you on that. It's, thousands of retired teachers who are under 65 on the district plan, but I can get you those numbers from the retirement board.
And they are on the district plan, they would be looking for a subsidy of $220 or $350.
Right. We're asking.
They want to be included in that.
Correct. We're asking that they be included in having the subsidy go from 110, which is what they're currently getting, to 220.
So if you could get us that number of additional retirees,
yes,
that would be appreciated.
Absolutely.
Okay. Great. All right. Thank you. Thank you, Mr. Chair.
Thank you, Senator. And thank you, Robin. This has been very helpful and appreciate your testimony today.
Yeah, thank you very much.
The next testifier is Dr. David Haas.
Senator Fanfara, Representative Scanlon, and distinguished members of the Finance, Revenue, and Bonding Committee. My name is Dr. David Haas, and I'm a practicing gastroenterologist in Hamden and an owner and partner of an ambulatory surgery center in both Hamden and Guilford. I am also the president-elect of the Connecticut State Medical Society, and on behalf of the physicians and physicians in training of CSMS, thank you so much for the opportunity to present the testimony to you today in support of Senate Bill 441, an act concerning a credit for ambulatory surgical centers. CSMS remains strongly opposed to any form of taxation on ASCs. Connecticut is one of only 3 states in the country to impose this burden on our ASCs, and we would strongly advocate for the removal of any such tax. Senate Bill 441 takes important steps in recognizing the strong track record of quality care and positive patient outcomes that ASCs bring to Connecticut. ASCs are safe, cost-effective alternatives for surgical procedures and medical treatments. we offer patients increased access to high-quality outpatient surgical and diagnostic services at much lower costs. As this state and the legislature grapple with rising costs of healthcare, ASCs offer lower-priced alternatives for procedures such as colonoscopies, endoscopies, cataract surgery, cardiac procedures, orthopedic and urologic procedures, among many. For example, in 2014, Connecticut patients saved over $6.4 million for having colonoscopies performed in ASCs. In addition, we see the expansion of high-deductible health plans in our state and nationwide, and that places substantial burden of the responsibility for healthcare spending on the patient. It is more important than ever that we preserve access to higher quality, lower cost care for our patients. The gross receipts tax on ASCs is patently unfair, burdensome because of the way it's structured. Every dollar in the door of the ASC is taxed without regard for expenses incurred, staffing employed, or equipment utilized. This has been particularly onerous during the pandemic, as we have had to have many additional expenses to protect our patients and our staff. The current ASC tax cripples ASCs by removing millions of dollars in capital, which could be reinvested to provide even better care for our patients. And unlike other businesses, ASCs are not permitted to deduct business expenses. Under the current tax structure for ASCs, ASCs are taxed at both small businesses as well as individual healthcare providers. This Senate bill would provide a tax credit for ASCs against the net revenue tax based on Medicaid services provided, and would allow the very deserving Medicaid population to receive even more benefit. In Connecticut, more importantly and equally importantly, we really struggle to retain physicians. According to data obtained from the most recent AAMC, American Medical Association College, Connecticut ranks 47th of 50th in retaining residents and fellows we train. The current ASC tax structure is a significant impediment. I work every day with residents and fellows at Yale New Haven Hospital, and one of the things they tell me that detracts them from staying here after training is some of the burdensome taxes that the state applies. CSMS asked this committee to support Senate Bill 441. We must preserve access for patients to higher quality, lower cost care, and do our best to retain the best and the brightest talent we can so that we can have physicians taking care of all of us in the future. Thank you very much for your time.
Dr. Haas, thank you for being with us today. Congratulations and condolences upon being the new head of the Medical Society. Well, I'm sure you'll be doing a lot of testifying in different committees in that regard, but we look forward to working with you here on finance. Senator Martin with a question.
Thank you, Mr. Chair. Dr. Haas, thank you for testifying. I like to know, when did we start taxing these entities?
I think it was at least 6 or 7 years ago. It was under the Malloy administration.
And was that prior to, I know that the hospital tax was an issue right up till I think the current governor, Governor Lamont, I think had come up with an agreement with you all, but that was not at that time that this tax came into play. It was with the Malloy administration.
Correct. Before that. And
it was always on the gross receipts.
Always.
It was. I thought we had fixed that a couple of years back.
There's been different. Yeah, sorry. There's been differences in some givebacks depending upon the amount that has been tax-free. Some discussions about having $1 million of revenue tax-free and then subsequently have tax thereafter. But it has always been on gross receipts, which makes it incredibly burdensome because not only is the ASC taxed, but then the revenue that's received is taxed again for individual owners of the ASCs.
So I guess it was Governor Malloy's way of making you sort of on equal playing ground with the hospital since they were being charged a hospital tax. Is that fair enough to say?
I'm not sure that it's a fair comparison. The ASCs are truly razor thin in terms of their margins. And in fact, during the pandemic, sir, ASCs were some of the only centers that were open doing elective procedures because I actually covered the hospital for 8 straight weeks in March and April of 2020 at Yale every day for 7 days a week. And we had halted all elective procedures within the hospital due to the COVID pandemic. So ASCs were the only ones that were continuing critical diagnostic services. And unfortunately, now what we're seeing is that because of so much care had been delayed preventatively, we're seeing the ramifications of that a couple of years later with cancers being diagnosed at later stages, but be it with breast cancer or colon cancer or what have you. So even more critical for ASCs to be supported to provide the care that patients need and at a lower cost. To be very frank, I do procedures both at outpatient ambulatory surgery centers as well as the hospitals. If you were to come to me for, let's say, a procedure, same physician, same equipment doing the procedure, it's going to cost you probably 3 times as much if you have a high deductible health plan to have me do that procedure in a hospital setting comparatively to an ASC. If it's safe for you to have it in the ASC, I strongly would support it for our patients because they bear the brunt of it if they have a high deductible insurance plan.
Why would we pay more in the hospital regarding an ASC facility? Why would that same procedure, same physician, let's say, why?
Yep. The facility fee is much higher for a hospital, and there's multiple reasons for that. The hospitals provide a tremendous amount of free care in the state, and we're all, myself being one of those providers, are very, it's a privilege to do that for our population. But the hospital facility fees are hospital outpatient rates comparatively to ambulatory surgery center rates, which with CMS, which dictates what those fees are usually much higher. And that's the cost that is then shifted to the patient.
Understood. So regarding the hospital fee tax, I'll call it that. Is that a 10-year agreement? That's sort of what I vaguely remember here. Do you know if there's a...
For the hospitals, I couldn't comment on that off the top of my head. I'd have to look that up and get back to you.
Okay, so if with the hospital tax based on gross receipts for them compared to your gross receipt tax, would it be comparable?
Oh, I don't think so, only because the hospitals have a much higher revenue. They probably are paying more, and I'm sure, I'm not here to testify on behalf of the hospital today, but I'm certainly supportive of doing what I can as a physician to make sure that the hospitals are able to provide the care that they need for our patients and the residents of the state of Connecticut. I'm sure they would be happy with a tax reduction as well.
No, well, I guess let me put it another way. So what I'm trying to get to is if your gross receipts are equal to $60 million, and let's say that's 6%, 7%, whatever it may be, are they paying the same amount with their hospital tax collectively?
30
seconds, I forget how many millions. I forget how many millions. 300 million, 350. I know at one time it was, 550 or 7. So I'm just trying to compare. If they are paying on their gross sales is equivalent to 7%, and your gross sales are at 7%, it's a fair amount that you're currently paying. But if theirs is, let's say, 3% or 2% on their gross sales compared to what you are paying, then that's unfair in my opinion.
Yeah, I appreciate that. I think the difference here, though, I certainly appreciate that support. Our margins are so much more thin in an ASC that same percentage can have a drastically different impact depending upon the institution that's being taxed. So ASCs currently in the state, many of them are barely surviving as a result of the fact of these taxes. And it really cripples our ability to hire additional staff, purchase more equipment that could offer even better care, quite frankly, because we're just limited in terms of the capital that we have. Because last year alone, I can tell you that some of the ASCs paid over $500,000-$600,000 of taxes. And let's say their EBITDA was 2.5 million on that. So that's a significant amount of money that's going out the door on gross receipts with no ability to decrease those expenses and those tax burdens.
Okay. Thank you, Dr. Huss.
Thank you. Thanks for your questions.
Thank you, Mr. Chair.
Okay, we've got a few other questions. Representative Clarice Dietrich, followed by Representative Meskers.
I think Representative Meskers was first, so I'll defer to him.
Representative Meskers first, and then Representative Clarice Dietrich. Look at that. Bipartisanship is alive and well in the Finance Committee today.
Exactly.
So.
I was going to say never look a gift horse, but I think that's the wrong metaphor. I don't want to get in trouble. So thank you, Representative Dietrich. Dr. Haas, there was a turn of phrase I wanted to catch on. The medical centers versus the hospitals, you made reference to high deductible healthcare plans. I'm assuming because the plans with low deductibles have relatively low negotiated rates at the hospitals, right? Versus the high deductible plans. So what's the comparison with the surgery centers versus the hospital with a normalized deductible plan? Because you said it was like 2 or 3 times higher.
No, all the contracted rates for procedures, they're all higher for hospital outpatient facilities across the country. So the same procedure, a hospital or a hospital facility will make anywhere from 40 to 50% more to have that procedure performed in a hospital than it will at an ambulatory surgery center across the board. That's just the way that the payment structure for years, as part of other organizations that I'm part of, and many physicians are arguing that there should be a site of service differential that doesn't exist anymore because it's the same quality care that's being delivered, and in fact, being delivered at a lower cost. But I'm very sensitive to the fact that the hospitals do provide a tremendous amount of service to patients that can't pay. And in some regards, this is a bigger discussion about our healthcare system. Some of the money that is being paid by employer-sponsored health plans is in fact compensating for patients that don't have the ability to pay for healthcare, and hence the reason why some of these hospital outpatient rates are higher, because it then allows for hospitals to continue to operate and provide that free care. And I'm fully acknowledging of that, and that's important, so we can provide care to the uninsured and provide care to and service to our patients. But that's no different whether you have a high deductible plan or a low deductible plan. The burden for the high deductible plan is just, it goes to the patient. So for instance, I have a high deductible plan. For me, I have a $6,000 deductible for my family. Until I hit $6,000 worth of expense for my personal health care and my family, I pay all of those dollars post-tax out of pocket. And so for—
Doctor, good. No, I'm on the insurance committee. I was there already. Okay. So I appreciate that. I'm aware. I was just trying to think, were you making a distinction between the high deductible versus the normal plans in terms? Okay. So basically you're saying 40 to twice as expensive at a hospital versus the centers. The question that we bandied about before you came on with an earlier person gave testimony was relation to, it's about a $16 million gross assessment on the tax collection from the surgery centers. So if we were to remove it from gross receipts at 6% and to put it to 6% of gross income or adjusted gross income, are we talking about $1 to $2 million roughly, or where? I mean, it's a massive switch. Not because, and I understand that it's a very regressive and onerous tax at gross receipts, and I understand the tax implication. What I guess I'm asking for, if we were to switch it to gross receipt, to adjusted gross income, what kind of tax are we collecting versus 16 million? That's my budgetary hat about what hole am I creating.
Yeah, I think it would differ based on the center, Representative. I can't speak for all of them. For the one center that I'm part of, it would probably drastically reduce it. But I'm not sure that it would do
Is it 10 or 10? I'm thinking it's going to be 10 to 20%. I said $2 to $3 million.
It might be slightly higher than that. It might be slightly higher. I'd certainly have to look specifically at our finances to see the differences, but again, it still wouldn't allow us to deduct certain expenses that standard businesses would be allowed to do just by gross income.
But those surgical centers that are barely break even will be paying effectively zero. So I'm trying to figure out a blended rate. And I think it's the right tax strategy or the right way to go. I'm just trying to figure out how much of a hole it burns in the budgetary side.
I appreciate that. The one point I did want to make in retort to that is that when I work with doctors in training, I can tell you firsthand that many of the physicians that train at Yale, train at UConn, they are well aware of things like this in our state, and it is a driving force for them to seek employment outside of Connecticut because they are potentially business owners in the future. And why would they want to pay 6.5 or 7% tax pre-expense deduction?
Expenses, right? No.
30 seconds, please summarize.
So when they can go to a neighboring state and basically have that money to invest in their center and purchase equipment that could allow them to take care of their patients better.
Okay. Thank you very much. No further questions.
Thank you. I appreciate the questions.
Thank you, Representative Metzgers. Representative Claridges-Deitria, are you satisfied with the answers you've heard, or you still have a question?
I still have a question. Thank you. Thank you, Mr. Chair. Thank you, Dr. Haas, for being here today. And I apologize. I know Representative Meskers did ask a lot of questions. I think that I was going to ask, but I was back and forth in different meetings. But my basic question is for people listening today and some that may not have heard the answers. What's the difference in patient costs and reimbursement between having a procedure at an ASC versus a hospital?
Thanks for the question. So if you were to have a procedure, let's just say a colonoscopy at an ASC, between the cost of the physician, the cost of the facility, the cost of any pathology, meaning biopsies that are taken, anesthesia that's given, it might cost you somewhere as a patient out of pocket, if you have a high deductible insurance plan, between $1,000 and maybe $1,500. Whereas if you have that same procedure at a hospital, it could cost you anywhere between $2,700 to $3,000 or more sometimes.
Okay, so I guess my next logical question would be, then why would someone have the procedure at a hospital?
So there's certain, yeah, that's an important question. There are certain exclusion criteria for patients who can't have procedures at outpatient centers. So if you have cardiac disease that's significant, or you have certain impairment with breathing where you have home oxygen, if you have a certain weight and height that precludes your ability to have a body mass index that's below a certain level for us to safely perform them outside of a hospital setting, those are things that are out of our control. Those are patient factors that mandate that patients have the procedures in the hospital. That is not the norm. It's I would say maybe 10 to 15% of patients that we see. And far and away, most of those patients are going to be better served at the hospital because there's additional resources that can be provided if they have a complication from a breathing or a heart perspective. But the vast majority of patients for these outpatient procedures, whether they be GI procedures, ophthalmologic procedures, urologic procedures, breast procedures, they can be safely done at the best quality in an outpatient center.
Right, and I think Senator Martin had asked what year this was implemented, and was it 2013, you said?
I think it was under the last or second to last year of the Malloy administration. I do not remember the exact year, but it's been at least 6 or 7 years.
Okay, and from your understanding, why did this start? Why did they implement this around 2013?
Well, to be very frank, it was implemented. We were watching this very carefully, and it was after 11 p.m. When the budget was going through its final reiterations, and this was thrown in at the very last minute, unbeknownst to those of us that were advocating on behalf of patients and physicians. So I think it was an opportunity to find a means by which to try to decrease the differential in terms of the budget. I don't think that it was thought of as something that was going to have as drastic of an impact as it would, and that it was truly, anyone at the State Medical Society will tell you, I bring this issue up on an almost weekly basis and how burdensome it is and how important it is so that we can retain physicians in this state. There is an exodus. I cannot tell all of you enough. There is an exodus of physicians from the state of Connecticut. There are only currently 2 physicians on the state legislature. I would love to see more on the state legislature, but there will not be physicians to take care of all of us in the state of Connecticut if we don't do things to try to promote ways for make lives for physicians easier and to take care of patients better. I'm trying to do my best to make sure that that message is heard. We have such talent that we train and then we just export them to neighboring states on a yearly basis.
Okay, thank you for your answers, Dr. Haas. I appreciate it.
Thank you very much for your questions.
Before I ask Representative Nuccio, I just would follow on with that, Doctor, that that's Connecticut in a nutshell. We train, we educate better or as well as any in the country, and then we export. Sad reality of our state.
We could change it.
Why don't you run for the legislature, my friend, and then join this small team that we have that even raises this issue from time
Drs. Anwar and Pettit are fine representatives, but I will consider that. Thank you very much, sir.
Okay, thank you. Representative Nuccio.
Thank you, Mr. Chair. So I'm been listening to everything you're saying, and I understand, I think, the crux of everything that's happening, and I'll be the first person to say I think ambulatory surgical centers are the place to go for efficient, quality, low-cost procedures, and they're definitely They're definitely better than going to the hospitals for the procedures that you guys do. So, which are very, it's slim, and what you guys can do, it's a good. So I'm all about trying to make that easier. But where I'm trying to kind of wrap my head around is, I absolutely agree. If there is going to be a surcharge, it can't be on the gross number. It has to be on a net number. But how do you see this being rectified? Because I think it was Representative Meskers that said, if it was a comparable amount as the hospitals, like a percentage in that, how do you guys see this? What would you like to see happen?
Well, if I had a wish list, I would like to see no tax.
I think most of Connecticut would like that, but
I hear you. I just want to state that up front. So thank you for indulging that. But recognizing the realities of our current fiscal system, I would say number one would be, as you mentioned, changing this from gross receipts. I know you acknowledge the fact that it should change, changing it from gross receipts to ability for us to look at it as a net number, and then potentially excluding certain populations from having that tax applied to. So excluding potentially Medicaid patients. And I know this bill speaks to the fact that it would reduce the number of burden on Medicaid patients, but also potentially for Medicare patients. And then lastly, potentially capping the amount that an ambulatory surgery center would pay in a given year. I think that would really be helpful, because that would allow ambulatory surgery centers to then budget more effectively for capital expenses to update equipment. Because there's always unforeseen circumstances that come about with any sort of medical equipment that needs updating, servicing, what have you. And those are not inexpensive. So in order to know how best to budget, especially with these margins that tend to be very thin, if we knew that there was a definitive cap on the amount that we would pay, regardless of volume of procedures performed, that would be tremendously helpful in our planning processes.
How would you like to see that cap applied?
In terms of what?
So if you say capping, what would you think would be a reasonable cap to put on there? Would it be a certain percentage up to X amount?
Yes, certain percentage up, because I don't think it would be fair to penalize different. I think you'd have to do it in some way that would be fair and equal to different centers that have different volumes. So to just put it based on a gross number, I think would be unfair. It would have to be a certain percentage up to a certain amount.
So a percentage of the volume.
Or a percentage of a net number that could be discussed at a later date, whether that's net revenue or net profit or what have you.
Okay. All right. That helps. Thank you very much.
Thank you for your questions.
So, Doctor, I did not hear the beginning of your testimony, unfortunately, so I may be inaccurate in my statements, but I'm disappointed that you, in your answer to Representative Nuccio about what would you like to see, that you left out this bill that's before us, which does one thing that the other avenues that or alternatives that you suggested do not, and that is to incentivize your industry to pursue serving underserved communities more than you do currently. Many, as you know better than anyone else here, that the majority of your facilities are located in what would be considered non-underserved communities. And this bill, if it's successful, would incentivize you to serve more folks from underserved communities. That's the part of the public policy that we seek in return for alleviating, if not eliminating, your burden in regarding the tax. And in fact, it goes one step further. I don't know if it's been spoken about today, but if you were to eliminate your obligation to the state under the tax, you could continue to go forward in serving additional folks that would qualify Medicaid or state employees and actually get paid by the state to do that. So there's a further benefit. Why? Because the more work that you do with folks who currently go to the hospital, the better the state is. If we do it right, it's calculated to ensure that the state benefits greater than what it loses in the way of revenue. So now you've raised other reasons why we ought to do it, namely that we're losing doctors, and the fairness argument that you're the only entity that's paying this tax anymore. But I would have preferred that you have the right to testify on anything and how you choose to testify, but you had me until the end where I wish you had recognized the value of the bill before us in terms of serving a community that is currently not a big portion of the ASC clientele, if you will.
Well, I appreciate your comments. We currently do serve the Medicaid population. It roughly amounts to about 7% of our patient population that we do treat at our ambulatory surgery center. We are one of the only ambulatory surgery centers that treats Medicaid patients in the state of Connecticut. And I'm also on the board of Project Access New Haven, which is an organization that provides free specialty care to those that cannot, quite frankly, afford insurance, but make too much to qualify for Medicaid. So I certainly agree with everything you're saying. There are noble points to this bill, and I certainly would support the bill. That's why I'm testifying on behalf of it. And I definitely believe in that social mission and that social cause. So I appreciate your comments.
And I did not hear that to the extent you said that at the beginning of your testimony.
I did not say that in the beginning, but thank you for allowing me to clarify.
And I thank you for the work you're doing for those communities. But I was speaking more about the industry in general in Connecticut in terms of the locations that they are and access to their facilities. But I'm hoping that if this bill moves forward in its current form, that those numbers will change. And thank you for your very informative testimony.
Thank you for the opportunity, sir.
Bree.
The next testifier is Seth Freeman.
Good afternoon, Senator Fanfara, Representative Scanlon, Senator Martin, Representative Cheeseman, and the distinguished members of the Finance, Revenue, and Bonding Committee. My name is Seth Freeman. I'm a professor at Capital Community College, president of the Congress of Connecticut Community Colleges, and a proud member of the Recovery for All Coalition. Thank you for the opportunity to testify today in support of Senate Bill 443. Reinforcing earlier testimony, Connecticut's state and local tax system disproportionately impacts low and middle income earners. This is a regressive structure that is disempowering and unjust, and it's a regressive structure that reinforces the gross disparity between the rich and poor in our state, and also reinforces the despicable racial wealth divide. The purpose of a tax incidence report is to provide lawmakers with historical data to enable reasonably accurate forecasting and informed tax policy decisions. Senate Bill 443 will ensure that the mistakes of the 2022 report do not happen again and provide more confidence for future DRS reporting. The General Assembly can make real transformational progress in addressing Connecticut's inequities by using coherent historical data and forecasting to inform their tax policy decision-making. Senate Bill 443 will ensure that future tax incidence reports are detailed and uniform, giving policymakers the tools they need to right-size Connecticut's unequal tax burdens. In our community college system where I teach and work, I see firsthand how our students suffer from our state's regressive tax structure. I see community colleges that are chronically under-resourced and understaffed, and I see community colleges that are struggling with persistent equity gaps as well. Sadly, this chronic under-resourcing is now manifesting itself in a destructive merger of our community colleges. Real harm comes to our students and all residents of our state from our regressive tax structure. Our state continues to accept the unacceptable. All of us who seek racial and economic justice need to support our state in doing better. And again, our state had the resources to build an equitable Connecticut, but we just need the will. SB 443 moves our state in the right direction in helping to fix an unjust tax structure. Thank you very much, committee members, for your time and for all of your hard work on behalf of the residents of our state.
We go again. Thank you, very much, Mr. Freeman, for your testimony. And I see no hands. Bree.
Thank you. The next testifier is Stan Sobey.
Good afternoon, Senator Fanfara, Representative Scanlon, Senator Martin, Representative Cheeseman, and distinguished members of the Finance, Revenue, and Bonding Committee. I'm Stan Sobey, Vice President for Public Policy and External Affairs at Oak Hill. Founded by Emily Wells Foster in 1893, Oak Hill is a leader in providing the highest quality community-based programs. Through over 20 distinct programs with 152 program sites, classrooms, and homes, We support Connecticut citizens with disabilities in 77 towns. We normally employ over 1,700 professionals to help meet the changing needs of close to 30,000 people with disabilities each year. We're a member of the Nonprofit Alliance and part of the nonprofit sector that employs some 15% of Connecticut's workforce. I'm here to comment on House Bill 5476 and to respectfully request the committee add language to Section 1 that exempts nonprofits from what are in reality new municipal fees, which would siphon money away from programs that help people in need. While already underfunded without a cost of living adjustment for some 15 years, the costs of COVID added on in order to be able to protect the people that we serve in our workforce. We've seen the growth of inflation surpass the funding adjustment in last year's state budget. That adjustment was directed to our deserving frontline employees, but provided no other funding for other increased operational costs. And in a worsening workforce crisis, every dollar is even more critical to recruit and retain staff to maintain service delivery. With a 20% staff vacancy rate, we've had to temporarily reduce services and close programs. In our state contracts, our state contracts do not automatically adjust to increases in costs. As providers, then, we are price takers and not price makers and cannot increase prices in the face of those increased costs. This means we are forced to cut services or close programs, which disrupts the lives of the people we serve and our employees who live, work, spend, and vote in our local communities. And in operating in dozens of Connecticut municipalities, fees will add up quickly and likely further impact service provision. Additionally, each municipality has been empowered to develop its own stormwater management program, which could result in different requirements and fee structures in each town. Community nonprofits cannot afford these costs, and we ask that you please protect nonprofit services by amending the proposal to exempt property owned by nonprofits from the fee. Thank you for the opportunity to speak with you today.
Thank you, Mr. Sobey. I see no hands, but I do want to make a comment that, and this is in general, I think your organization does great work, but the challenge here for me and for others who understand the perspective of both sides is generally the nonprofit army, if you will, is very effective in this kind of setting where the testimony against these kinds of measures, not the first time we've seen this type of thing, suggesting that nonprofits should pay their fair share, so to speak. And there's a lot of support in the legislature for nonprofits, no doubt about it. But I don't see a similar amount of activism when it comes to changing the policies, advocating for policies that would assist municipalities so they don't have to go after nonprofits. We turn assessors into detectives in Connecticut in order to generate the revenue they need to keep a mill rate manageable, to provide the services in their towns. So they have to fight their own battle, and that's why you see these kinds of proposals. But there doesn't seem to be the coordination of effort, where certainly if towns had the resources, as I said, they wouldn't be proposing, or maybe there'd be fewer proposals that would impact nonprofits, and you wouldn't have to spend your day waiting to testify before us. So that's a perspective that I wish that there are others from your industry would consider in terms of this issue. It's not a matter of going after nonprofits because they're an easy target. You're not an easy target. You're a very tough target, frankly. And you know that because they haven't succeeded to this point. But the problem doesn't go away of underfunding the fact that we continue to rely on one major tax, the property tax, as the means for raising revenue for towns to be able to meet the needs of their community. And there hasn't been the will in this building to change that either. So, and that could be an hours-long conversation alone, Mr. Sobey. There was a hand up, Representative Mashinsky. She may have declined to ask a question. And I see no others. So, Bree.
If I might, Senator.
Certainly.
Thank you for stating your thoughts. Very much appreciate hearing that, and would just say that in my life away from Oak Hill, I am a former elected municipal official, and I am not unmindful of the tension.
Thank you, sir.
Thank you.
Bree.
The next and final testifier is Dan Bahamas.
Yeah, nice try, Bree. But nobody gets it right on the first try. So everybody, I'm Dan Paul Hamus. I'm the town councilman, town council chairman, I should say, of Avon. So thank you all for the opportunity to speak with you, and thank you all for your service to the state. And thank you for considering our veterans. We've all heard prior testimony that hits on many of the points that I agree with in support of HB 5478. It's an active property tax exemption for certain veterans. I'll keep this short and hope that you can all grab a bite to eat. So there is an urgency here. At a $50,000 income limit, this exemption can make a real difference to low-income veterans across the state. Rather than repeat prior points from other testimonies, I figured it'd be valuable to just give you an example of the discontinuity in the income-based exemption here in the Farmington Valley area. In Avon itself, our veterans are eligible, obviously, for the $1,500 basic exemption that applies to all veterans per the general statutes 1281G. And in addition, we allow exemptions of up to $10,000 for our veterans whose income does not exceed $57,500. We have around 500 veterans receiving the basic benefit of $1,500. We have 93 eligible for the income-based exemption, so making less than that $57,000. The cost of our income-based portion of the program is around $60,000, and we wouldn't expect it to change significantly if the exemption was changed to 10%. We actually would not qualify for reimbursement. I think in my submitted testimony, I misstated that in the written testimony. We wouldn't qualify for the reimbursement, but there's not much change that would occur here in Avon as a result of this bill. We do routinely, however, compare the income-based exemption to those of our neighboring communities. Avon, Burlington, Canton, Glastonbury, Granby, we all have pretty comparable programs. It's around $10,000 exemptions with similar income limits, but there are several other neighboring communities in the Farmington Valley with substantially lower exemptions, like $2,000 to $4,000, and income limits well below the $50,000 mark. I think most of these towns would be eligible for reimbursement under the proposed language of the bill. We also have a smaller group of neighboring municipalities that have already moved to the proposed 10% of assessment, like Simsbury, or even a greater 10% or $10,000 like West Hartford, in combination with a higher income limit than our own, and higher than those specified in the proposed bill. So, to summarize, I think allowing for the standardization of a minimum exemption across municipalities while retaining flexibility of local choice for extended benefit would be my preference to provide relief to those veterans most in need. And I also think, and I heard this come up earlier, consideration of both real and property tax would be most equitable. As a town, we would also like you to revisit or ask you to revisit the language in section 1281G. that specifies the basic benefit, the $1,500 basic benefit. It hasn't been updated in over 30 years. And as a result, has not increased from the $1,500 exemption of assessed value in Avon since its inception. And given the current language, it's unlikely, I think, it would ever change here. The original intent of that legislation, which is recognizing all veterans, has lapsed. And it's only getting worse in the current era of rapid inflation. So in Avon, we would appreciate the opportunity to exercise a local option to increase the level of the basic exemption if it does not happen at the state level. So thank you again for your consideration of the veterans, and thanks for allowing me to come and speak.
Thank you, Mr. Polhamus. Representative Cabros de Gra.
Thank you so much. Always good to see one of my constituents. I appreciate your time today. I just wanted to go back to the point you said about the fact that Avon would not be reimbursed for this, because we did hear testimony earlier that this would be, a burden on taxpayers in the towns that would not be reimbursed for this, that are above that 150,000 equalized grand list amount. You said it's approximately $60,000, and that'll be give or take depending on if this passes. Do you know, approximately how many taxpayers that there are in Avon, and what that number would be per person in terms of increasing their tax burden?
Oh, gee, I mean, we have 18,000 taxpayers, so yeah.
Okay.
Yep.
So it would be a fairly small number, I think is what you're saying. So I won't put everybody through the pain of me doing the fast math in my head. But I think that the point that you're driving home is that we're trying to do right by folks, I think is what you're trying to say.
Yep.
Okay.
Yeah, no, I think, we're trying to do right by folks already. We are offering this exemption, but what I don't like is looking around the area, and it's just, it seems unfair that if you really believe that low income veterans deserve this kind of helping hand, I think it should be consistent across the state. It's definitely not. You can see that even in our little microcosm of the Farmington Valley.
Okay, thank you so much, and I won't keep everybody from lunch any longer. Appreciate your testimony.
Yeah, thank you.
Thank you, Representative Cabros de Gra, and I see no other questions. Thank you, sir.
Thank you.
Bree?
We have exhausted the list of testifiers. We're all done.
I'm sure you could find a few more, couldn't you? Don't worry, folks. Thank you all for hanging in there today. And we will, I'm sure Bree will let us know when we have to meet again.
We'll see each other Friday, if not before, Senator Fanfara.
All right.
Exactly. We have a public hearing scheduled for Friday, March 25th at 9 a.m. We'll see you then.
Bye, everybody.
Have a good afternoon, everybody.